Welcome and good evening, everyone. Welcome to International Symposium hosted by Architecture Department, no, hosted by Faculty of Design and Architecture and Design, University Putra Malaysia. And for today, the title of our symposium is Post-Pandemic Urban Revolution Resilience, Autonomy and Community Care, specially organized by our lecturer here, Dr. Marek Kozlowski. So we have about 6 presenters today, and all presenters actually came from about 6 countries across the globe. So we have time difference between 8 hours to 13 hours. So we are lucky here in Malaysia that we are at 4 o'clock, still a working time. But our colleagues here from other countries or some part of the globe, they are actually very early in the morning. I think some of them at 4 o'clock or 6 o'clock in the morning. So without further ado, I would like to start the symposium today by inviting Dr. Sohardi Maulan, the Dean, Faculty Design and Architecture, University Putra Malaysia, to address a welcome note to all participants, including the speakers. Over to you, Dr. Sohardi.
Thank you very much, Architect Sophie, for that introduction remarks. So, salam and very good afternoon to all the speakers and participants of this symposium, uh, Post-Pandemic Urban Revolution, Resilient Autonomy and Community Care. So, I would like to take this opportunity to thanks and to congrats Faculty of Design and Architecture for being able to organize this international symposium, and notably to the Department of Architecture for especially Dr. Marek Kowalski for being so hardworking in organizing this international symposium, in which I think it is very important for us from all over the globe to share the common ideas and concern regarding the pandemic that we are having now, COVID-19. So as you all of us know that this is probably the lifetime opportunity, because the last worldwide pandemic that we have actually in 1918 to 1920, when we have the Spanish flu issue all over the globe. But now we experience it again. So probably it is the best time for us to share what we think about the pandemic and what we think as the designers, architects, and planners on what to do, what we have to do with our environment to make sure that we are ready to face the challenges in the future. Of course, in the future, with all these technologies, the urban mobilities and the easiness to travel all over the world, everybody can fly, right? So the issue about the pandemics is easily, or about the disease, it can easily become the pandemic because of the easiness we travel all over the world now. So, but we, as the planners, we need to be ready. And how can we do it? And then, so the topic of the symposium today regarding the post-pandemic solution is very timely, and how to make sure that our communities actually is resilient, have certain say in making decision, and how can we actually care of each other. So in that regard, so I hope that this symposium, uh, as Juan Sophie said, will be well represented by the participants and speakers from 6 countries. So it is a very important, and it's going to be very meaningful platform for us to discuss and to find common issues and commonalities for us to move forward to make our place a better place to stay, and to make our society a better society to be. So in this regard, I once again Thank you very much to all who participates in this symposium. And again, congratulations to the organizers of this symposium, especially the Department of Architectures, as well as the Faculty of Design Architecture of University Putra Malaysia in make this thing happen. So thank you very much. Assalamualaikum warahmatullahi wabarakatuh and very good afternoon. Thank you.
Over to you, Dr. Wan.
All right, sorry about that. Okay. I would like to invite the first speaker for today's session, Dr. Marek Kozlowski from University Putra Malaysia.
Okay, good morning, everybody in Europe, and good afternoon to all my colleagues here, and very early good morning to all our friends in Brazil. Okay, let me open the sharing here. Yep. Okay. Everybody see the screen?
Yes.
Yeah, okay, great.
Yes.
Okay, well, in April 2020, three of my colleagues in Australia, renowned urban designers Kim Dovey, Quentin Stevens, and Jonathan Daly, wrote really interesting articles saying that we cannot allow coronavirus to destroy our cities. I think nobody then anticipated that we're going to be in this crisis for 2 years, and still after 2 years we still don't see the end of it. That's why it's important to actually identify measures and strategies for our cities that can allow them to properly function and be vibrant until the end of this pandemic, in the post-pandemic period, and be sufficiently resistant or resilient for future pandemics. This introduction to the post-pandemic urban revolution is an outcome of the research that we've done at University Putra Malaysia, together with the Malaysian Institute of Architects. In addition, I should mention that we discussed the three themes of the workshop, which is resilience, autonomy, and community care, with all the presenters. So there is a consensus on this issue. And the main aim here is actually to determine how our cities can actually function and become better places to live and visit and work after this pandemic. So basically, the contents of my presentation will go back a little bit to history, talk about the positive outcomes of past pandemics, the sort of like misconception of lockdowns and movement control orders, the new world order, and then I'll go to the levels of intervention and the three themes of the urban revolution. Okay, let's go back to history and look at the 19th century. 4 epidemics of cholera in Europe and the world, and that killed tens of millions of people throughout the 19th century. Actually, they triggered something positive, that cities started to build new sanitation systems, new water supply systems. You must remember that the fresh water was brought to the cities during the Roman period, and then it was discontinued for centuries and centuries until it was reintroduced in the 19th century. So that was a very positive outcomes. 19th century, the flush toilets were introduced at the end of the 19th century, and the sewage system was introduced. So actually, this was the positive outcome of the pandemics. The authorities and the decision makers decided that we have to make our city more healthy, sanitary, better than they were before. And of course, the parks were developed, recreational facilities. That's where the first football matches were performed. So a lot of positive outcomes deriving from the cholera pandemics. Then we come to the 1980, 1920s, the Spanish flu, which killed 50 million people. So if you translate that to the population, The Spanish flu was 40 times, not 10 times, but 40 times more deadly than COVID. And after the Spanish flu, we have also the 1920s, a new approach to architecture, the emergence of urban planning, separation of uses, approach to providing housing for everybody. And one might ask, how come in the 1920s, without vaccines and without antiviral drugs, it was possible to actually stop end the Spanish flu? Well, the question is, the Spanish flu did not end in 1920. It continues, actually it continues really until today. What happened in 1920, it merged with a seasonal flu variant and became less deadly, a little bit similar to what we're experiencing with today's Omicron. It became less deadly. And because there was no media frenzy then, no statistics and all of that, the political agenda was very sort of like quiet about the Spanish flu. So there was nothing, no political involvement like it is now. People just got on with their lives and created one of the most vibrant decades in the 20th century, the 1920s. Well, you remember, change in the architectural style, change in fashion, change in the way we live, the new technology, even our most favorite toy at home, television, was invented in the 1920s. So it was a great period. And it is quite important that we also achieve good outcomes from today's pandemic. Okay, when the pandemic arrived in 2020, the first action of all the countries around the world was lockdowns and movement controls. And nobody neglects that. That was a very good move. And countries that actually started quickly to shut down and to impose movement control orders, like Australia, Malaysia, New Zealand, achieved in the beginning very good results. Countries that were slow achieved a lot of, experienced a lot of deaths, a lot of unnecessary illnesses and all of that, unnecessary crisis. So it was a really good sort of thing to act quickly. But then there's one thing: you don't repeat yourself, you move forward. And continuing with lockdowns and movement controls into 2021, when we already have vaccines, when we already have antiviral drugs, that is one of the biggest mistakes a lot of decision makers made. And actually it creates frustration. Look at those images here. This is Rotterdam in the Netherlands, a city that I lived for 1 million, which was under siege in November because of an imposed lockdown. And people were just furious because they were all vaccinated. And they said, what's the point of being vaccinated if we go into lockdown again? Luckily, that was the only country that went into lockdown, and it didn't help them anything. After 4 weeks of lockdown, they had the same increase in the numbers of Omicron cases as any other country that did not go into lockdown. Another image here from the American-Canadian border, where it was totally paralyzed. The border was paralyzed for 2 weeks because people were demonstrating against lockdowns and against movement control measures. So politicians are aware that they cannot continue this because people do read statistics, people are aware, and people know that it's not anymore the way to combat the virus. You did it in the beginning, great, but you don't repeat yourself, you move forward. Okay, let's see what science says about it. And I've picked here 3 renowned virusologists around the world, 3 professors. Professors Martin Kulldorff and Professor Sunetra Gupta. He's from Harvard University, she's from Oxford University. Both were supporting the first lockdown and movement control measures, but then they said that the whole approach is wrong because actually it's the elderly that are really targeted by the virus, not so much the young, and we should actually be more flexible in conducting lockdown. So both of them were actually anti-lockdown since mid-late 2020. Professor Devi Srinhar, she was extremely pro-lockdown. She was and she still is a vocal critic of the Boris Johnson government. But in her latest interviews and for the past few months, she said, let's move forward. She is actually supporting opening up borders, opening up schools. She said, we've got the tools now. We have to fight it. We have to be cautious. So she still suggests that we use masks in big gatherings or when you go into a plane or train or bus, which is quite logical. But she says, absolutely no more lockdowns because we have to move forward. We have to confront the virus. We have to be ahead of the virus, not the virus ahead of us. And I'd like to point out to a very latest research done by a joint venture between Johns Hopkins University, University of Copenhagen, and Lund University, where they doing the method of meta-analysis. They looked at lockdowns and mortalities. And the final research came out with a major finding that lockdowns had very little effect on the mortality rate. I think overall, globally, it was 2%. And this is based on existing data. This is not mathematical modeling that governments ask their technocrats to do to support the decisions. This was based on existing situation, 2%, and that was done before the vaccines came into effect. With the vaccines, I think that figure would be lower. So this is a very interesting research. I've left a link here to that research. I do suggest everybody 70 pages of analysis and data. It's a good document to read because it's very convincing. They've done 18,000 samples, so that's absolutely enough to have a convincing result. And it proves definitely lockdowns are no more a tool to fight the virus. Full stop. Then we come to border controls, another favorite way to do it. And actually, I have a picture here of the big bad wolf trying to enter the house. So you close the house all around because the big bad wolf cannot. So the big bad wolf does not enter the house. This is the idea of border closures, and we are all saying that COVID is a global pandemic. Well, it's a global pandemic. You shouldn't close. Okay, in the beginning, as I said, yes, but afterwards, you shouldn't close to your neighbors. Do we close to our neighbors when we have common problems? No, we open up to them. And anyway, border controls and movement control measures are also in the research by Johns Hopkins University were also regarded as having practically no effect on the number of mortalities. So unfortunately, the virus is not a big bad wolf. It can enter any closed area. It can go through any police patrol, army patrol. It's not scared of machine guns, tanks, whatever you put there, it's not scared of it. So you cannot fight the virus with war tactics. It just does not work. And the WHO, which actually was very vocal of containing and closing up in early 2020, called many times in 2022, stop closing your borders. And I'll give you a very good example here. Hong Kong, yesterday. Hong Kong, as you know, has got the most draconian regulations in the world. You have to quarantine for 21 days in an isolated area for 21 days. And if when you enter the country, and even with that draconian control, they've got 56,000 cases in the last 24 hours. That's just as much as Paris, London, New York in the worst days of the pandemic. An absolute failed policy, absolute failure. And this is an example that, okay, in this whole pandemic, there were, of course, examples like the American president, Donald Trump, the Brazilian president, sorry, Brazil, I have to mention him, Bolsonaro, who are two downplaying very much the whole issue of pandemics. But there were also a lot of draconian rules that actually went over the threshold of absurdity. And if some of our satire dystopian writers would be alive now, like Franz Kafka or Anthony Burgess, I'm sure they would write a good, interesting book of the illogical draconian rules that some countries impose, which don't have any effect in reality whatsoever. They just make people's lives completely miserable. Okay, having all said that, I'm going now to the existing situation. Well, as we know, there is a changing world order. And you must remember one thing before we start sort of like contemplating about strategies and approaches for city, that the new world order has changed. There's new players. All the big pharmaceutical companies, like for instance, you probably saw that one of the special guests of the G7 summit in England last year was Mr. Burla, who is the CEO of Pfizer, and Mr. Tedros, who you will see in television more than the President of America. There's a lot of people who made huge careers out of this pandemic, really huge careers. And it's really interesting to see the Financial Times. They've printed a list of 100 companies in 2020 that made huge profits. I'm talking about billions of dollars, not millions, billions of dollars as a result of this pandemic. And it's not only Netflix and big pharmaceutical companies. There's a lot of companies, a very interesting read, and I've left the website here. And one thing is also media frenzy. Media frenzy, I'm all for independent media, and they've done a great job in sort of like exposing what's happening with what the corruption among politicians and all of those intrigue things. But then I've noticed that during the pandemic, there are actually approaches to scare people. So for instance, they talk about records and spikes all the time, and they don't analyze it downwards. They don't say, yes, there was a record of cases in Tokyo, but only 2 people died. They don't tell you that. They just say, oh, record 20,000, 15,000. They just play with numbers. And also, well, we know very well about the 16 Downing Street parties during the lockdowns in the UK. And it was, I'm sure, and we all know it wasn't just this case. There was more cases. So there's actually a group of people, a big group of people that are not subject to all those restrictions. So we must remember that there's could be a lot of people out there, could be a lot of decision makers, could be a lot of influential people that actually might not be interested in ending this pandemic too quickly, because this is their way of making profit, making money. And I would refer everybody to this book. It was written 400 years ago, but it's so valid. Machiavelli, the Prince. It sort of exposes all, it is actually a manual for how people can gain power, how individuals can gain power. And then actually it imposes all the immoral ways of achieving power. Very interesting book, and it's still valid until today. Okay, I'm coming to now to the approach we need today. So definitely we need the global approach. And there's a very interesting research done by Edward Glaser and David Cutler, 2 professors from the US, about global approaches to pandemic. And they said that we need quick, swift reaction if we know there's a new pandemic, something they compared to NATO forces. So that the army can actually go land and secure an area very quickly. WHO has not got the authority to do that. Anyway, WHO, let's put it frankly, have failed in preventing this pandemic to spread around the world. Their responsibility is to stop pandemics. They failed with COVID. Then we need the regional and national approach. It's very important to have the national and the regional approaches. And in terms of the regional approach, it was only the European Union that actually introduced this COVID pass, that actually allowed citizens to travel between countries, that helped the tourism industry. It was a good example. People may say a lot about the weak things about the European Union and its problems. It does, but yet during this crisis, it proved to be a united region. They've developed a regional path that is valid even in countries like UK, which left the European Union, Switzerland, Norway, and even in Turkey as well. So this is was a good approach. And secondly, we've got local intervention that I'll talk about now. Okay, in terms of the local intervention, the big cities, it is imperative and very important to make the cities resilient to future pandemics. And by resilient to future pandemics, I mean introduce a whole set of urban intervention measures which will actually allow people to take control of the public spaces. A very important phrase, moving out indoors, outdoors. And this is happening all over everywhere, not only in hot and mild countries, but also in temperate countries. This is an image of how cafes have taken over streets of New York. This is an image of how a public space has been converted into an outdoor cinema in Berlin in summer. So those are all the ways we can do it. The idea of a 15-minute city where all the basic necessities are within 15 minutes of walking distance from your home. Idea launched by the mayor of Paris last year, which is now being implemented. Of course, the smart city approach, the smart public transport, the clean air policies, extremely important, because it is also proven, research was done, that in cities with clean air, the number of severe and deadly cases was less than in polluted cities. So this is something extremely important. Then we go to, of course, for the cities to launch resilient policies, to launch all the measures, we need to have self-governance and autonomy of the cities. They need to be self-governed. They need to impose the regulation. They should decide on the degree of any curb and measures. It shouldn't be in detail directed by the central government. And I think one of the successes of Australia in this whole pandemic was that the federal government did nothing. They had just guidelines, and they ensured that the vaccines came. All the decisions regarding lockdowns, when, how, were all done by the state premiers, not by the prime minister or his government. And that worked really well, because you are in charge of your state, of your locality. You know what issues are. And the same applies to the big cities. The big cities have different problems than smaller cities and the rural areas. So they should decide here on how to actually conduct lockdowns, and if necessary, or other curb measures. And it is important to have elected mayors, elected representatives, a permanent community dialogue, and of course, smart urban management. And I've included images of 3 mayors that are quite known to be actually challenging the existing system and trying to enforce as much as possible self-governance. That's the mayor of Paris. She actually launched the 15-minute city. Ada Colau, mayor of Barcelona, and she's been vocally against all the big giants that actually trigger high property prices in the city. And London Breed, the mayor of San Francisco, and very, very strong opponent of Donald Trump, and a very strong fighter for justice and safety on the streets of San Francisco. So we really need strong mayors supported by the public, that are trusted by the public, that actually have a permanent dialogue with the community and its representatives. Last but not least, community care. So full participation of the community in decision making. Evidence-based design. Design should actually be different now, the way you assess buildings. The building should not be assessed in terms of, so much in terms of height, bulk, and how much car parking spaces or setback. It should be based on how does that building impact the community. So a whole research should be done in the way how the community would do that building, how they would view that building. Evidence-based design was started in hospitals, in hospital design, and it actually was to find design measures that would actually help patients heal in a hospital, starting from the function of the hospital, from location to even the materials, internal materials, design material, building materials. So this is also another important way. Hybrid work patterns. You can work now from everywhere. And the whole thing, everybody knows about it, but the mindset of some of the management is still that working here, you have to come, show your face. It doesn't matter what you do, but at least you show your face. You're there from 9 to 5. You can sleep all day, but you're there, so that's it. That's not anymore the case. You should work from every location, from a beach, from a plane, from anywhere you are. You can still work, conduct seminars, conduct lectures, conduct interviews, meetings, whatever. This is all a very hybrid mobile way of working. And of course, last one is achieving full gender equality in decision making and social and ethnic equality. And to end, the last thing I should say, if you look at the whole history, you will notice that pandemics have caused problems. The Justinian pandemic was probably the worst during the peak of the Roman Empire, but they never sort of like diverted history or destroyed our civilization. Climate change has already. The Mayan civilization in Mexico and in Central America was destroyed by climate change, and closer to our home, the Khmer civilization in Cambodia was also destroyed by climate change. So we've got a very strong enemy, and climate change cannot be dealt with drugs or vaccines. This is Mother Nature, very difficult to find. And I have to go a little bit, last thing I want to sort of like remark is the conflict in Ukraine. You can see what real disaster is. And I remember one woman exiting Ukraine to Poland. The journalist asked her, she was packed in a train. Wasn't she concerned that, there's a lot of people, she might get infected with COVID? You know what her response was? Excuse me, what is COVID? Okay, on this sort of remark, I'd like to end my presentation. Thank you very much.
Thank you, Dr. Marek. Thank you for the presentation. Just to remind our audience, just now was the introduction to the post-COVID urban revolution. Dr. Marek Kozlowski with Datuk Kamal Zaharin of DPZ Asia Malaysia. Thank you. Over to Sophie for the next presenter.
Okay, thanks, Dr. Wansri. Okay, I also would like to remind everyone that at the end of the 6 presentations today, we're going to have Q&A and discussion with the speakers, with all the speakers. So you may like to address the speakers later. So if you like to do so, please post your questions or your query on chat box here on Webex, or you can actually raise hand so that we can invite you to address your question personally, or you can also, for those who watching on Facebook, you can post there as well. We will check the question and we'll read out the question for you. For those on YouTube, I'm not quite sure how you're going to address your question. That probably can be done later, but at the end of the day, we will compile all the questions and we will post it to the speakers today. So next, without further ado, I would like to invite our second presenter today, also from Malaysia, Mustafa Kamal, from Architect Mustafa Kamal, and his presentation titled Post-COVID Urban Environment in Malaysia. Over to you, Mus. Screen is yours.
Okay, thank you very much, organizer from UPM. I'm Mustafa, an architect from Kuala Lumpur, Malaysia, practicing for the past 30 years. Good morning, good afternoon, good evening, good night, everyone from Malaysia to there. And I would like to present and also share some my suggestions and my thesis on how the post-COVID urban environment, maybe some will be in Malaysia, but some will be outside. So when we're talking about urban, right, there's a lot of problems of urban, but I'm going to concentrate on the problems of open spaces and also on health issues as well as clean water and food, because this is actually most important, and this is the one that kept the city to actually be at a standstill when people are locked down, nobody goes to the city. So of course, when we're talking about urbanism, we're talking about all these 11 items of the city, where you have a quality of life, connectivity, and about the national neighborhood, the density, transportation, and sustainability. So we are looking at how we can actually approach a quality urban design through a very productive of protocols, where it involves productive use of land, the livability of the land, and also the sustainability of the land. So when we have achieved all this should be the best what we call additional, and also the combination of cities. And also when physical items will be put from these three items, you're talking about stability of the politics, you're talking about the health care for the city, and you're looking at culture and environment, because this is actually the one that makes people sane during especially lockdown, or also when you're actually working in the city. And education, so that people can actually grow, and infrastructure to support this whole, whether the city is small or big. So rather than just cities, I'm also talking about settlements, and we are looking at resilience. You know how the resilience program has got to be balanced out with what we have in terms of capacity, and whatever strategies that we can actually go with the assets that the cities have. So the resilience is actually how you actually recoil back, recoil back from all the stresses. And I think COVID and pandemic is one of the stresses, and you should be rebounding back almost immediately. But some cities take it long time, so we need to actually have about 4 P's and the 4 V's in order to achieve this. So we need to learn to prioritize. We cannot have everything. We need to learn to plan, and we need to actually to choose which one to protect and which one to provide, so that we have creating a very good, vibrant city, vital city, value and variety, or else the city will just be like another standstill and also boring city. So when we talk about COVID, it really puts me thinking, what actually are we looking at? I think we're looking at life. We are looking at how we actually use time and how actually we use space. Do you really need to go to work to go and do your work, and also space in the office space to do your work? It seems that now with COVID, you can actually work anywhere. So actually, it's not about where you are. It's actually how you get to actually organize yourself to do the work. Do you really need to buy everything? Now we actually know that we only need to buy things which are very, very, very important. And we need to actually learn how to spend wisely, and how the city will actually work for us. So what we need to do now, we need to have a new looking at the new normal city. What does it mean there? And we're looking at how we actually need to use the cars and roads. So you need to have accessible city, like Dr. Mari was talking about 15 minutes. You probably can walk to the shop. You don't have to buy one loaf of bread from a mall, queuing up for 3 hours just for one loaf of bread. You can go to the neighborhood city. Later, I will show some examples that we have done that can actually achieve what we need to do. So when we're talking about the cities, how we actually handle about the climate change and disaster mainly. Now we have got to handle with pandemic, COVID-19. Who knows, we're looking at other problems. So this balancing of the healthiness, the governance, and also urban design, we're really, really testing the whole administrative, the whole design team, and also the people of the city to actually now learn how to live healthily. And health is going to be the most important thing, so that we have a very good social mind, mental, and also physical. You suddenly everybody wants to exercise. Before this, nobody give a damn about exercising. We will look at about the mental. Nobody's talk about mental. We are talking about how do I make money for the next 12 years, 12 months. Before this, everybody was talking about profits, but they're not talking about health or social and also mental and also physical embodiment in their life. So we need to actually learn how to do this. And I think one of the most important things, we need to look at how urban centers need to actually learn to promote these 5 things: how to be livable, how to be in work in the community, how to give opportunities to the vulnerable population, and to promote equality from all these opportunities and community-based design. And it has to be sustainable, so that the cities can move forward. And you can actually have, whether it's pandemic, the city just still moves like it's actually a well-oiled engine. And in order to do that, you really, really need, from those 3 diagrams that I did, we need to actually look at how we handle distancing measures, how we do urban dynamics, how we do living and working patterns. And the most important there, right, the center there is still talking about design. And we need to learn about how you have to do it in a most efficient manner. So one of the ways that we can do is we can look at the existing stock about how to adaptively use the cities. Malls can now be used into something else. We can use into hospitals. We can use into office or houses, or even places where people can become a temporary COVID-19 or whatever pandemic monitoring system. So all these big infrastructure malls around where used to be a lot of people, we now have got to actually redo and relook at how adaptive reuse can be done. Factories be made into apartments, workspace, collaborative workspace. You know, all some of these buildings here, they are actually once used to be offices. And in Malaysia, they took over one of the malls and make it into the online shopping mall where the Oslaju, which is our courier service, they do all the distribution for them. So suddenly during the pandemic, everybody starts to use courier service. So in some of the inner cities, we need to revive, you know, how we look at all the small lots and small shops to actually how they can actually be used to a new use. And this use can be a lot. And these famous real estate people are looking at, we can make inner city a livable one. And they are now converting, you know, from an office to become a hotel use, from what used to be a cinema becoming a cultural and creative community hub, like scale, for instance. And we're looking at how a mall which was dead, we are looking into a healthcare center, which is hospital. So these are some of the ways, you know, that we can actually rethink, relook, and also reassess our strengths and our spaces that are available in the cities. So, you know, we need to bring back life into the city. And this is where adaptive reuse is very, very crucial. And this is where new works can come in for all designers, whether it's the developer, whether it's actually the city hall, or also from the consultants who actually done, you know, from these huge open spaces with few columns. It's easy to do hospitals. You know, you have the perfect height for it. You can bring daylight. You can actually bring some floors to bring daylight all the way down to the basement level. So this is actually only need some creativity use. And you also, because of the big floor area, you can actually have all these new things that come in. You know, you can, because the infrastructure is there, the building is already there. You don't have to wait for 3 years for it to be completed. It just needs to be think of how to make it internal spaces much more conducive and much more healthier. So the opportunities is there, and we just need to put our mind. And this is some of the items that we are going to achieve from there. When adaptive is, look at this, from an old cinema, it becomes a food center. You know, it's very creative from this old cinema. I used to go there. It's a 1,200 seater cinema, but they actually converted it into all these exhibition centers. This is actually a orchestra space where the sound is very good there. And it all started with Central Market, where it used to be a city marketplace. In 1929, all these food stalls and also the food that comes in, vegetables, and also other things starts to come into the city. And before it's going to be demolished, the architects and also designers said, City Hall, wait for a moment. I think we can reuse this to become one of our most favorite space. They call it Pasar Seni. And this is how it looks like, where cultural and also spaces for arts are there. And you can actually have the local scene where you have the souvenirs there. And some of it, like for instance, from the office space to become an apartment, you can actually do just a manual tweak of the mechanical, electrical, and power system. And in London, they also use some of these court and police stations to include to become office and also houses. So it is actually looking at how these spaces and these buildings, rather than go into the demolition, you actually now create something new, something integrated, as what I've spoken just now. You create a much more vital variety and also value space in the city. So pandemic has actually taught us that it's actually a reset button for us to think something better, something new, and something which is actually invigorating to your minds, to your heads, and also to the economic system, because we need the new game changer. And from all this, you know, like for instance, we rarely see in the city hospital. So what we could do is, from some of the hotels or even offices, replanning, you can actually become a very good acute center. And this can be done with the help of the mechanical and architecture also, so that you can have various ins and out of your ventilation. You know, in Vancouver, the old railway marshalling yard in the city of Vancouver, what they did was they actually make it into a kiddie center, to a place where kids can play, and also a place where arts and culture comes in. So they don't demolish this building, and this is actually how we can actually just, with the top of the mind, this becomes something new. This is what used to be, and this was actually used to be a railway marshalling yard. And from there, it becomes a community center. And everybody in Vancouver, especially these area in the Font Creek, they all congregate to this area and become a railway museum, and it's actually a place for people to rejuvenate their minds and look at history. You know, you need to learn about history in order for you to understand about city, and people coming out together. And now with all this vaccine, you are able to do this sort of activities in this whole area. And in Penang, old shop houses are now converted into all these hotels and also becoming green, and also the oasis in the city. So we are able to do in one of our developments in Shah Alam. We develop a 1,000-acre development where we come in as this green area, where it's actually providing a deny, or they call it a green trail, a 5-kilometer green trail over 1,000 acres, which is actually part of the open space. And from this, what happens is it actually connects all the residential area with shops, neighborhood, so you don't have to actually go out of this place in order to buy things. You just walk or even take a bicycle to there. So the whole community is actually within a center. And true enough, during the pandemic, you are not allowed to go out from 10 kilometers outside of your house. Here, you're able, within 10 minutes, you're able to go and buy your food, and also having a place that you can actually call home, and also do a lot of your exercises here. So this is how, where we, my friend from Holland was talking about how we need to actually look at product, the interior, the architecture, and also urban in total approach now, rather than in segmented area. So we need to look at all those, then we can actually live into a new life, which is to be not just a new normal, but a new reality. And we need to move into a reality where office now can be either remote, hybrid, or you work inside there. So when we look at adaptation of the space, we need to understand that the technology is also merged together. Video conferencing, you're looking at even using your phone to actually meet with people. So the way that we are going to work is going to change. We need to move with the change, because we cannot be make ourselves bogged down that you need to work in an office. Like for myself, in my office, only my administration staff is actually in office, so that they can receive courier, we can receive parcel, they can receive any physical thing. But my architects and others are working from their home, so that they can do and also be much more productive, because they are now using the office as a bridge for them to do a coordination meeting once in every week or every 10 days, so that they have this form of personal health and wellness. And these are very, very important for us to actually create this new nourishment wherever, when we work in the office, in the city, we need to have this nourishment. And we need to have the short-term solution, and we have to have the long-term solution. And in both systems, you need to look at your air, ventilation, lighting, and how you actually look at nature. We need to go back to nature in order for us to move forward into the future, because for a long, long time, we actually failed to make ourselves be part of the nature. We forgot nature. We just ignore nature, and we say that without nature we can live, but actually no, nature can live without us, but we cannot live without nature. So we have to actually learn how to use this, and this working remotely will create a better staff retainment, because they will not go sick. They will have enough rest. They can do their work like 24/7, because they know that if they don't complete that 7 or 8 hours per day, they can do it overtime, because they know it's their home. Then they don't have to actually burn the oil of petrol into the city, and it creates a better working relation, not just between themselves, but also with the family. Sorry, I got to rush this through. You all will get some of these slides, so you all can read it better, because I would like to offer here essentially what are my thinking, and what is where Corona is actually teaching us, which is actually to look back that we fail to actually use nature as our solution. So these are some of the things that we researched that's very, very crucial, that we now have got to use. They call it value-based design, so that we can actually have a better, good use of workspace and also learning space. So with this COVID-19, what we have learned also, that materials are very, very crucial. Some materials can have a retainment of a virus, some don't. So we now are better equipped with the knowledge of all these things, and we have got to actually learn to use our knowledge using better. So we cannot just say, work on hearsay, but it has to be on evidence-based. And all this part of the city, especially on the entrance, you need to use your cleaning up. These are now the new ways that you need to actually look at, so that you are becoming a healthier people and a healthier worker. And once that happens, the city becomes healthier. Okay, so hygiene is actually heart of this whole matter, and the crowded area is now reduced from controlling the crowd. You can have a high density places, but you need to control the crowd. You know, in Auckland as well, they are looking at how they can use the inner city industrial area. You know, from just a desolate industrial area, they are now using it into a park, a public park in the harbour, where the harbour and open space works together and becomes an open space, which also can be a central entertainment and also cultural center. So this is where the silos, they did not destroy it. So what they do is this is where they put the concert, the sports area, and these are some of the things that can happen in the city. And this is also another way of adaptive reuse is very crucial. So I think adaptive reuse is the new way of development, and all the city stock, whether it's a building, whether it's a space, whether it's a road, whether infrastructure, can be reused and be made into better space. And of course, when we had the lockdown, the initial space was using a full of 1.5 meter, but it is nice also in the sense that now we actually understand the meaning of open space, a meaning of sharing, a meaning of collaboration, and a meaning of looking at nature and also ventilation and open space as part of a life in the city. We cannot now forget it, and we have to make sure that this is all living together with the people of the city. And I think all designers, all architects, all city planners, all local authorities, even the government needs to look at designing towards health, the most important part whenever you're actually looking at cities to be a new way of using. Okay, so with
Sorry
that, I
to
would like
interrupt.
to close my session. Thank you very much.
Okay.
Okay, thank you, Architect Mustafa. Okay, must agree on him on cities must build resilience and advocate for inclusive adaptation programs by linking local knowledge and global resources. Okay, we'll go next to we will go to the next presentation, which is titled Building Community Resilience in Kenya by Asma Mehan of Royal Netherlands Institute of Art and Science, Nidi Odor Canadian Architecture Center, and Sina Mustafawi of TU Delft, Netherlands. The screen is yours. Are they?
Thank you very much. You're now sharing on the screen.
All right. Can see that? Okay. Can make
you
it
see?
full? Yes.
Yes. Perfect. So just let me start, and thank you very much. I want to just thank you all and for organization of this interesting symposium, and also Mark specifically.
Sorry, Asma. We are looking at your presenter screen now. Maybe you put it as a full view.
I
Full
see.
screen side. Yeah.
Yeah.
Try again. Put on full screen.
Yeah. Let us do it again. Okay. How about now?
Well, we're looking at the presenter screen with your notes on.
Okay. I see. Yeah.
Perhaps you're having two screens, are you? Yeah, now better. Just now, before you turn off. Yeah, this is good.
This is good. Okay.
Yeah, this is perfect. Thank you so much.
Okay, let's start. So thank you very much. Thank you everyone for this great symposium. And I want to thank specifically Marek for organizing this and all the efforts that UPM has put together to present to this symposium. So I'm Dr. Asma Mehan, and on behalf of the team, today I open up this session. And we are delighted to share our collaborative and still ongoing project titled Socio-Spatial Micronetworks, Building Community Resilience in Kenya. So our presentation today is divided into 3 sections.
We've lost your voice, Dr. Asma.
Yeah.
Now, okay, you're back.
Okay, thank you very much. So we are a team of three. Nidiodor, master graduate of Dia Bauhaus, is currently affiliated with the Canadian Centre for Architecture. I'm Dr. Asma Mehan, senior researcher in Portugal and Netherlands, working with University of Porto and University of Leiden. And next to me is Dr. Sina Mustafavi from TU Delft and Dia Bauhaus in Germany. So the theoretical background of our work addresses three major challenges and research themes. Also, the previous presentation was talking about the community resilience. So first and foremost, the adverse effects of the COVID-19 pandemic and challenges shows us that we needed the need of the lack for the multi-scalar community resilience strategy. So in line with the United Nations Sustainable Development Goals of 2030, UN SDGs, I will call them, we try in this publication that you can see here, and if you go to the QR code, you can get access. We try to come up with an alternative and coping mechanism for future challenges. So this is the theoretical background. I don't want to go into detail. So Nidhi?
So the second pillar we are building upon are on co-design and micro networks with the context of pandemic and post-pandemic urbanism. So the COVID-19 pandemic is presenting a very unique opportunity for us to consider strategies of urban and community planning and designing. So we need to design for communities, and this is important because many of the world's populations actually depend on social communal living for survival. So these post-pandemic strategies should consider that we might be in a time where we might prepare for other pandemics and natural disasters, and we must always analyze and speculate how communities around us exist. And we also have to envision viable ways of augmenting the self-built culture of marginalized communities around the world.
And the third and the last field that we are aiming to address and implement in this research is digitalization as an overarching realm. More specifically, we are interested in empowering communities to systemic thinking, human-robot collaborations, cyber-physical systems, and more importantly, data-driven design and decision-making in the context of this research, which we are going to discuss when we are presenting the core case study, which is in the context of Kenya.
So moving toward the second part of our presentation framework, we will elaborate on the theoretical and methodological frameworks of our project. So I will kick off the emergency of this team, the Resilient Communities, as part of the Venice Biennale's Italian Pavilion in 2021 with the theme of the Resilient Community. So the Italian Pavilion exhibited and showed the seriousness and also the urgency of the pandemic and also the climate change and the significant challenges we can name, such as the urban manufacturing and agricultural systems that architecture is called on to face. So in line with the theme of the Italian Pavilion, we organized several roundtables, discussions, symposium, and seminars to raise the awareness on the theme of the urban resilience from the environmental, economic, and also social point of view in relation to the 17 SDGs that promoted by UN Habitat. As part of this project, we invited the different range of professionals and urban activists who in different parts of the world, in Italy and abroad, try to implement the different and multidisciplinary practice of the resilience. So we inspired a lot from these projects around the world and also in different scales. And also we agreed that the resilient communities have organizational skills and we need the different type of people and resources and also the invention and entrepreneurship and also experiment to be able to act beyond what belongs to the established practices, often in very difficult and unfavorable economic conditions.
Moving towards methodological aspects, for instance, I can bring this example in which from a methodological point of view, we are looking into the resiliency in communities in favelas in Rio de Janeiro, by informing the distribution of the resources through participatory workflows, which are empowered by technologies. So we are interested in this notion of programmable architecture. As you can see in these projects, the users are programming their built environment through this integrated design to production systems. So this is building upon the framework of what we call Industry 4.0, which is about cyber physical systems and connectivity between digital design systems and communities. Which on the one hand is about looking into the sequence of construction and sequence of production by rethinking how we can benefit from building with communities through cyber physical systems. And on the other hand, it is about the way we can empower and inform the process with the modalities of human-computer interaction and computation. Related to this work, that the case study of us, this notion of quantified self, which you can also call it self-tracking, which was also presented in the previous presentation, is about how we can, in a more personalized level, our research can be informed with data-driven design and decision-making processes. For instance, in this experimental projects, which is about walk your city and create, or listen to your music and create, we are considering how this notion of quantified self and self-tracking, which has become very much important during the COVID time, can inform the designers and planners from a more personalized level of data. And again, in line with these methodologies and theoretical frameworks, we move on to the core topic of today and context of today, which is Kenya, in which I introduce this project done by NIDI, the thesis project, which is about a participatory approach and empowering women communities in Kenya. NIDI.
Yeah, so the project that is stated has a participatory approach that is keen on using contextual design challenges as a key for core design. So it was based in Turkana and addressed the unique challenges that a particular group of women were going through, marginalized by their community. And so the different contributions of different kinds of women about how they desire to use space was key in mapping out their activities. This mapping out was context-specific, culturally conscious, and had a functional design methodology. So the project, which had a strong feminist lens, was keen on using digital design as a methodology for addressing structural and societal inequalities. So moving forward, I will introduce the context and the case studies that will analyze a form of community design strategies that were geared towards the pandemic. So Kenya is an Eastern African country. It has a population of about 53.7 million, and about 28% of these live in urban areas. So I think when we're analyzing, we're going to see this dichotomy of urban versus rural, because Kenya has this dynamic of a lot of urban strategies and rural strategies. So since the beginning of the pandemic, Kenya has had 300,000 reported cases of COVID-19 and 5,663 reported deaths. Of these reported COVID cases, the capital city and the urban areas accounted for about a third of the infections. And it is clear that there are stark demarcations between urban and rural, arid, semi-arid, and the highland regions of the countries. These demarcations are also visible in the strategies employed by the government, the Ministry of Health, in collaboration with health organizations. So Kenya has 47 counties, and each of these counties has a sort of government that defines the kind of strategies that are used for different communities within these areas. So in the next slide. So the first case of COVID was reported on 12th March 2020 by the Kenyan government, with other agencies like the National Emergency Response Committee came up with a few guidelines and a few strategies to slow the spread of the virus and to prevent a countrywide health exigency. So this included rigorous testing and quarantine centers. There was mask mandates that required masks to be worn in all public areas and facilities. Then there was a suspension of incoming flights and all non-essential travel. There was closures of school and also closures of non-essential public spaces. So this included restaurants, bars, and churches, among others. Then there was also a countrywide curfew that was enforced by local law enforcement. There was also a rigorous contact tracing and tracking methodology that used digital tools. So I will discuss a few strategies that I notified within the country that were done by various communities to sort of combat COVID. So one of the CDC's recommendations was rigorous hand washing. And so in this, while the government and local governments employed strategies that were countrywide, they were not far-reaching within many communities. And so many communities had to devise contextual methods to survive and to curb the effects of COVID. So the CDC had recommended vigilant hand washing and disinfection as a deterrent to infection. And hand washing stations, as you can see from this image, came up as a form of combating this. So the hand washing station is made up of a refillable water tank, a tap, and a wastewater collection reservoir, and is placed at the entrance of every building, with guards ensuring usage by all incoming users. With every public space that required to have them, so local artisans were sourced and they fabricated various designs and methods of having the hand washing station. So the practice has now become commonplace in most urban areas in Kenya, and this has led to an urban awareness of hygiene and health practices. So this is lending the question of, can we formulate from the pandemic and thinking about pandemic practices, can we formulate new urban practices that enhance resilience in this case? So a practice that is geared towards hygiene. And then next, I will discuss the community innovations and other practices. So there was a concern raised by health officials about the touching of taps when hand washing as a possible site for infection. So the foot pedal mechanism was devised. The foot pedal mechanism allowed for control of water and soap without the users, without contact by users, and it also ensured the station remained clean after multiple uses. So various designs have been created across various towns with varying types of materials and mechanisms. So to enable distribution across various entrances, local governments, health centers, and businesses commissioned local artisans to make the stations and distribute them. I think this is one of the really good innovations that came from the pandemic within the urban areas. Next, I will discuss the same sort of innovation, but within low-income areas. So in low-income areas, as you can see, this hand washing station is made up of a plastic jerry can with a tap that is soldered onto it, and water is refilled at the top, with the top is cut off, and also soap is also provided for hand washing. However, you can see that there is no wastewater collection, and it drains into the drain. This still poses a health challenge in areas where drainage and sanitation is not formally planned for. It's therefore important to augment the kind of production that happens, especially in low-income areas, and ensure there's full protection during these times in the pandemic, and also thinking about incoming precarious conditions. Next, I will discuss mutual aid. So there was an economic downturn as a result of, like the presenter before talked about, lockdowns and enforced curfews, and it was mostly felt in low-income areas and workers in the informal sector. So there were furloughs and industry was shut down, and government restrictions essentially meant that a large number of people could not cater for their daily needs. And while there was tax reductions and stimulus payouts, it still did not cater for a significant part of the urban population. So this is where micro networks of mutual aid and care covered greatly where the government could not reach. So there were donations from well-wishers, fellow Kenyans, institutions and corporations. There were donations of food, money, water, and essentials needed by people to survive. So mutual aid is ingrained and built into the fabric of how Kenyan societies live, because people always fundraise for burials, weddings, school funding, and the practice was even heightened during the pandemic through these food donations and donations of essential services. So this could not be possible without the informal micro-social networks that drive this form of mutual aid that was seen across various communities in Kenya. Next, I will discuss the community-driven social justice. So like I said, there was a national curfew that was imposed on 27th March of 2020, and it ran from 7 p.m. to 4 a.m. and it was to be enforced by the Kenyan police, and their presence was immediately felt within the city. And the Kenyan police is known and has a history for heavy-handedness when enforcing government orders in the past. So during the period between the curfew being announced, there were reports of police brutality, and there were over 15 deaths that were reported. So there were local rights groups, for example, the Social Justice Center Working Group, the SJCWG, that decried and protested this police brutality. There were also protests all across the country to protest the kinds of killing and the enforced disappearances and that were exacerbated by the government restrictions. So localized rights groups, usually started by locals who live and experience these injustices, form a crucial network for addressing rights violations, and they were especially instrumental in the reforms that happened during the COVID-19 period. The Kenyan government is known to bending to the will of international rights groups, and because of fear of sanctions. And so it was nice to see the impact of these localized groups that sort of gained great ground in fighting for the rights of people who are not considered by these government restrictions and government lockdowns and curfews. Next, I will discuss the utilization of digital proliferation for information dissemination. So Kenya has a very high proliferation of use of mobile phones. So there's about 80% proliferations of mobile phone usage. And so it was interesting to see how the Kenyan government and the Ministry of Health utilized this opportunity to sort of have reach and to disseminate information. And so the proliferation of digital services in Kenya is mostly influenced by services like M-Pesa, which is a service that allows for transfer of money and financial services across mobile networks. And this is being used by over 90% of the population in Kenya. So the Kenyan government and the Ministry of Health utilized this, and the use of USSD codes that Kenyans use for like buying of airtime and other mobile services. And they use this to sort of have a way of disseminating information, and also it was aiding in contactless services that ensured that there was distancing and did not stop the spread of the virus, curb the spread of the virus. And so these services could be interesting in thinking about how digital proliferation and how people use mobile services or digital services to think about how we're going to use these services in times of crisis. Next, I will discuss vulnerable communities. So Kenya has one of the highest numbers of refugee camps in Africa. It comprises of 3 large refugee camps that have populations of over 200,000 in Kakuma and Dadaab, which has 150,000 refugees. So in the time of the pandemic, it was especially precarious for these communities because, one, the Kenyan government was stating that it wanted to close down these refugee centers, these refugee groups, and also there was the precarity of living in a refugee camp during a time of a pandemic and the spread of the virus. And so it's interesting to see the kind of strategies that come up from these communities. So, for example, these video grabs are from a group of women called Alinjoga's Women's Association in Northern Kenya, and it took to the task of countering misinformation in the COVID-19 area. So this area is also prone to security attacks, precarity because of attacks from the militant group Al-Shabaab. And so the Al-Shabaab was also spreading misinformation about COVID-19 and COVID-19 vaccination. So this group took initiative after local health centers had shut down due to the insecurity and the surge of the virus. So they used solar radio that they purchased, and they went from village to village, spreading the right information from viable.
Just to remind presenter, could you summarize? Thank you.
Oh, okay. Yeah. So again, these same women also using their local vernacular methods of building to kind of think about how they will have vaccine centers in the future. So in conclusion, I think it is important to note that the strategies that these microsocial networks use for survival could be interesting for thinking about future crises, and they could require us to be more aware of how smaller communities are able to navigate the difficulties in their context and to augment and design for these strategies. So using this research, Dr. Asma and Dr. Sina and I are developing an article from these themes, and we're trying to use these themes not only for putting out research material in terms of papers, etc. We're thinking of having them within teachings, and they're also using it within studios, and we're trying to have them integrated into different contexts. Thank you for having us.
Thank you very much.
Thank you very much.
Thank you very much, Sina, Nidhi, and Asma for sharing that. I wish we have more time. Perhaps we could invite all of you again for more extensive discussion. The project is very interesting to me, but unfortunately we have to proceed with the next presentation, which I would like to invite Anna Wisiwizy from SGH Warsaw School of Economics, Poland, and Orlando Troisi and Mara Grimaldi from University of Salerno, Italy. And the title of their presentation is Different Shades of Resilience, Smart City and COVID-19 Pandemic. It's rain and thunder over here in Kuala Lumpur, by the way. I hope you didn't hear that too much. Okay, over to you, Anna. The screen is yours.
Okay. Can you hear me?
Yes, perfectly.
Oh, good, good, very well. Thank you very much. So, everything works because we have had several problems. My neighbors drilling the walls and my students talking to me and the speakers not working. So I got very stressed at some point. Hopefully everything is okay now. So I see that you are smiling, so I understand you can hear me.
Your volume is already at maximum, Anna?
Good, thank you very much. Yes, okay. Can you hear me?
Yes, I hope your setting on your side, on the volume is already at maximum. It's a bit soft, but we can hear you clearly.
Yes, so I'll just speak louder. This is just good. So I just speak as I should to my students. Good.
Yeah, that's
so,
perfect.
Thank you very much. Thank you very much. Basically, I'm so amazed by the presentations that I listened to by now. So thank you very much. I got this pleasure of Salerno, with whom I've had the opportunity to collaborate for quite some time now, and it's always a pleasure. And the topic of our presentation today is post-pandemic urban revolution. Basically, we want to focus on resilience in smart cities. So without any further ado, I just give the floor to my colleagues, and I'll be the last one to present. Thank you very much.
Good morning, everyone. Thanks, Professor Wisiwizy, for our presentation. The study aims at detecting the key drivers for smart cities, well-being and resilience in the COVID era. The diffusion of COVID-19 forces private companies and public institutions not to comply with an imposed social and technological evolution. The new tools introduced to challenge the limitation posed by pandemic redefine resource integration and information sharing, and change the rules that guide actors' interactions. The complexity of the context requires today's company to manage disruption through a proactive attitude, to turn crisis into an opportunity for growth and prosperity. Hence, public and private companies COVID-19 era should adopt systems business model to manage with unexpected phenomena. For this reason, managerial studies focus on the study of resilience as the ability of a system to develop adaptive reaction to stress events or changes. Thus, resilience can be intended as an attitude to systems adaptation, to the constant reshaping of economic, technological, and cultural practices to address evolving needs of a changing context. In a period of emergency, resilience becomes one of the most investigated topics that contribute to identify the drivers for survival in a turbulent context. So resilience is studied as one of the most powerful perspectives to address disruption in contemporary cities, and as one of the key indicators used in smart cities planning to assess urban sustainability and growth, and to identify the drivers for viability, to help cities manage unexpected events such as natural disasters, global crisis, and also conflict. When a city planned to be smart, it must also be prepared to be resilient. Contemporary contexts, cities are intended as complex systems in which resilience can be developed through multi-level processes based on an integrated set of digital technologies, on analytics that can facilitate information sharing and that can help systems overcome disruption through the co-creation of new knowledge and innovation. Hence, starting from the need to explore the key drivers of resilience, the research project we are discussing today aims at addressing two research goals. The first, the identification of the enabling factors for the implementation of resilient practices in smart cities that can support contemporary smart cities intended as systems, the management of crisis, context complexity, and technological and market evolution. Second, the analysis of the combination of these factors to develop innovation. And so starting from the identification of the different kinds of innovation co-developed in the city through resources integration, technology-mediated interactions, and knowledge sharing. This way, a relationship between resilience and innovation could be investigated. So these two questions will be addressed through two case studies by Mara Grimaldi and Professor Visvisi in the next presentation. So I give the floor to Mara Grimaldi for the next part, please.
Thank you. Good morning, everyone. So, as discussed in the previous slide, we performed an empirical research that seeks to investigate the key resilient practices implemented in particular in two smart cities from Europe, Athens and Turin. The aim of the empirical research is to assess which are the key strategies, technological tools, the key interactions to comply with the limitation posed by the pandemic. The empirical research adopts a qualitative approach based on content analysis and in particular we extracted textual data from official websites of the municipalities of the two cities, official statistics, strategic documents, to extract some key variables to enrich, revise the key macro categories that guided the analysis. So, as discussed by Orlando, we can reframe smart cities as systems, urban systems in which the new technological tools that exist before the pandemic, but were boosted after the advent of COVID-19, reframe smart cities as multi-level relationships between private, public, civil society actors that exchange resources through new technology-mediated interactions. Hence, we started from Ernst & Young report. Ernst & Young is a multinational consulting services that seeks to identify the key drivers of smartness. So we can see that resilience is one of the 4 dimensions of smartness according to this report, together with accessibility, inclusiveness, and sustainability. In particular, according to the report that was elaborated in 2020, Ernst & Young identified 4 macro categories for resilience: infrastructure, mobility, communication networks, and monitoring systems. As we can see, we can associate these dimensions with the subdimensions of cities as systems discussed by Orlando. So this classification can confirm that smart cities can be intended as complex set of technology, infrastructure that simplify communication flows and information flows, and that also can have an impact on societal level. For this reason, starting from Ernst & Young report, we subdivided the key dimensions of resilience into 3 main macro areas: organizational resilience, societal resilience, and digital resilience. Starting from this preliminary classification, then we identified some key variables that can guide the analysis, the content analysis. In particular, we subdivided different variables according to the 2 research questions. For the first research questions, we re-elaborated from literature, from Thaler, from Lawrence, and the other key studies on resilience, the main enabling factors of resilience. The same, the majority was discussed by Orlando, so infrastructure, technological dimensions. For the digital dimensions, information sharing, communication networks, and for the societal level, social connections, and all the potential resilient practices and projects implemented in the 2 cities to enhance social inclusion. As for the second research question, we employed the drivers, or we can say better, the key outcomes of resilience. We reframed them as innovation outcomes. So we established a relationship, a potential relationship to be assessed between resilience and innovation. And we conceptualized the innovation outcomes starting from managerial literature, in particular literature on service systems. So the subdimensions that guided the analysis for the dimension of innovation were new attitudes, new interaction modalities, new skills to be detected in the 2 cities after the advent of COVID-19. So the first city analyzed is Turin, which has been ranked 2nd place in the most sustainable and resilient smart city in Italy from Ernst & Young, and in particular, Turin can be considered as a best practice for 2 key dimensions of smartness: innovation through open laboratory, open projects, and Turin City Lab project in particular, and then for the social inclusion, so the social level. Obviously, Turin started the path toward sustainability and smartness before the advent of COVID-19, but thanks to this technological infrastructure, Turin was able to redefine the tools implemented before the pandemic, after the advent of COVID-19 to comply with the new technological evolution and the challenge of social distancing, smart working, all the challenges posed by the advent of COVID-19. So we tried to classify the findings obtained according to the three dimensions of resilience. As for organizational resilience, in particular, it can be revealed that Turin established collaboration, a network of collaboration between private, public, and non-profit institutions that help citizens comply with the limitation, above all the technological and psychological limitation posed by pandemic. Through projects like Accessibility Network Now, Turin provided support and free access to digital services by providing mobile devices, addressing problems of connectivity and so on. So the key aims, according to the key enablers of resilience implemented are the reduction of inequalities in the access to technology, the removal of psychological, technological, and economic barriers to the use of technologies imposed by the advent of pandemic, and different kinds of novelties deriving from resilience. In this case, for this first dimension, were the a new kind of organizational mindset that spread in the city across different kind of private and public organizations to redefine digitally the ways of living, of working, of studying of citizens. Then, for the second, as for the second dimension, the digital resilience, a very complex and detailed technological infrastructure was implemented based on open innovation projects that introduced platforms to connect the citizens, to enhance the interactions between and among citizens and institutions despite the limitation of social distancing. So despite social distancing, the social connections were improved through the simplification also of information flows and through the active engagement of citizens in decision making through the project of Turin Social Impact that engaged civil society in the resolution, in the co-creation of new solutions to address pandemic and all connected projects. The result, if we want to analyze the result regarding innovation outcomes, it can be revealed that new practices for interaction mediated through technology and for knowledge sharing have been introduced. Lastly, as for the societal resilience, we can consider this dimension as the synergistic outcome of the first two dimensions. So at a societal level, the new kind of technological digital skills provided, the new infrastructure implemented, finally improved social inclusion of citizens. So it can be revealed that at a macro societal level, through different kind of social projects that provided help to disadvantaged stakeholders and so on, in the city, a solidarity network for inclusion has been created, and the different kind of novelties, so of potential innovation that came from resilience are related to the introduction of new ways of addressing social needs and to enhance citizens' commitment. And now it is my pleasure to give the floor to Professor Anna Visvici for the second case.
Dr. Grimaldi, thank you very much for this presentation and for setting the ground for focused on two examples. So the city of Turin and the city of Athens. Clearly, the COVID pandemic has influenced each of the city worldwide in a different way. and therefore different policy tools and different solutions were given priority by the city authorities. In the particular case of Athens, the challenge was multiple and could be divided into the following categories. First, the authorities had to juggle the challenge of the sheer size of the agglomeration and of the scope of the measures undertaken and the diversity of population that inhabits the city. So Athens is a city inhabited officially by 5 million people, which would be like roughly about 50% of Greece's population. But there is also a substantial number of people that are not registered, which means that it is feasible to say that the population would be of, let's say, close to 5.5, 6 million in a rather limited space, which creates a great number of challenges. So this is the point, geographical spread. The problem in this context was how to coordinate activities or solutions that were thought to be decisive in containing the spread of the pandemic and thereby safeguarding health of the population. The situation was the more difficult that people frequently unaccounted for, that is the migrant population, would defy the measures undertaken by the local or national authorities, thereby making the execution of strategies aimed at containing the spread of the pandemic the more difficult. Which means that as a result, the following measures were employed by the city authorities, both at local, regional, and national levels. So Greece has introduced one of the most severe restrictions on mobility in the entire European Union, comparable only with the case of Italy. The restrictions on mobility included restriction on mobility within the specific districts where people live, within the city as such, and within administrative units of the country, which means that you were not entitled to leave the specific area where you stay, your district, in the region, and it wasn't possible to actually get on the highway to move across the country. At some point, curfew was introduced, which meant that starting from 8 p.m., you were unable to leave your house. In case you did so, you would have had to have very important reason to leave the house, but the police would stop you. New hygiene practices were introduced at individual, yes, and city level, which means that you will see on some pictures about present later, the city authorities actually used the fact that the city was empty during the night to thoroughly clean the city. So it was high pressure water with chlorine and whatever else was necessary to actually clean a public space. So as a result, today, that the pandemic is essentially over, this is at least the mood in Greece, the city is much cleaner, which is, I think, a good thing. So how were the measures executed? First and foremost, the society members were requested to follow very strict. I'm going to put my headphones because my neighbors are getting crazy today. So the society members All right, I hope you can hear me. So the city were requested to register any attempt of movement. This is why we talk registry of mobility. And Dr. Grimaldi, if you could change the slide so that you can present it, which essentially means that if you wanted to leave your house, you would have to fill either an online form or print out a form or send an SMS at a specific number, which would basically notify the authorities that you are planning to move within
the clearly defined and strictly defined area. And there will be very specific reasons that would entitle you to mobility, which would be, for instance, going to the pharmacy, going to, let's say, delivering your child to, let's say, a parent in case you were divorced and so on. So you would have to have a very good reason why you do that. You would have to indicate the time and day of your attempted mobility. So in case, let's say, police would stop you and they were entitled to do so, you'd be able to make your case that you did not abuse your right to mobility. Now, surprisingly to many, the Greek society behaved in a very disciplined and obedient way, which means that people actually followed the rules, which resulted, and Dr. Grimaldi, if you could just change the slides, which resulted in Athens being absolutely empty. So what you can see on the first picture is the Greek parliament and someone driving on moped, and the police officer is actually checking the document, whether the person has it. So it was like a very frequent practice. What are the implications thereof? So Dr. Grimaldi, if I could have the last slide of my part. So basically, I would like to make a case that through several crises in the 21st century, including the economic crisis, which basically means a drop in GDP of more than 25%, with all its societal implications. Greece was able to use the COVID pandemic to build a new form of resilience. And in line with the typology that we are applying in this study, this resilience can be interpreted at three levels. So it is the organizational resilience, societal resilience, and digital resilience. As regards organizational resilience, we have clearly seen that the authorities, both at the city and national levels, they were able to improve the mechanisms and the efficiency of coordination and execution of their activities. Most importantly, though, we have seen that the communication strategy devised by the authorities, be it at national and local levels, was in the first place very well coordinated, and secondly, very well designed, so that the attempts to, let's say, mislead or attempts to create confusion among citizens has been basically preempted, which means that the citizens were receiving very clear, very well coordinated and focused, simple communication, simple message from the authorities, which I argue increased people's propensity to behave in a responsible and disciplined manner in view of the risks and threats related to the pandemic. As regards societal resilience.
Could
Yes?
you wrap up, please? Thank you. Could you wrap up, please?
Yes, I'm just wrapping up.
Could you summarize? Thank you.
Yes, I'm summarizing. Thank you. So societal resilience, it's all about discipline and health concerns driven solidarity. This is something that is relatively new for the Greek society, in that people started caring even more for each other. And I would link it to cultural factors such as uncertainty avoidance index. So we could elaborate in it. And finally, during the COVID pandemic and the related crisis, the society was able to, or Greece was able to build, or the city was able to build digital resilience, because the mobility monitoring system that was put in place basically required the authorities to install or implement, develop a new ICT-based system and actually make people use it. And people did it. So as a result, today, the third year into the pandemic, a great number of related services have been implemented, and people, by now so well socialized with these tools, are able to and willing to use them. So I'll stop here. Thank you very much.
Okay, thank you, Dr. Vizvizi, for the great presentation. It's good to know that many of the countries are into digital platforms to enhance urban resilience. So we'll go next to another presenter, which will look into bathing and healthy cities, some reflections on urban environments by Dr. Simon Hewson of Coventry University, UK. So Simon, would you mind sharing your slides?
Yep. Okay. Can you hear me?
Yes, very clearly.
Okay. Thank you for your attention. I'm just going to share my PowerPoint. So I don't know if you can see that. Yeah.
Yes.
I'll put it on
full mode. Thank you.
full mode. Thank you so much. Well, building on the theme basically of the previous speakers, basically about resilience, my study is focused on UK bathing facilities, but it has implications basically in terms of overall resilience from the infrastructure perspective. And the basic theme of this research is it kind of exposes, it links how COVID has exposed underlying issues that I think we've all touched upon in terms of resilience. So basically, the pandemic exposed regional health inequalities. The backdrop to all of this is there's a huge UK health challenge that we're only just getting to grips with. I suppose we could say overall we've been following a sort of globalization agenda, and this pandemic's kind of revealed weaknesses in that mode of thinking, effectively. And that's compounded the issues we've had with the GFC, basically. On top of these, both of these have kind of exposed the neglect that's happened regionally in regional infrastructure and how public and private organizations kind of cooperate. So basically, in this little presentation, I'm going to look at the UK health challenge. Then the study looks at the literature briefly, and it does touch upon cities in antiquity as a contrast, really, and particularly ancient Rome. So that will be, hopefully, some people will be more familiar than others, particularly our Italian colleagues there. So the first aspect was to look at a structured review of sports facilities and health. And then it's a mixed methods approach. So there was a quantitative analysis, statistical analysis, both cross-sectional and longitudinal. And that was followed by qualitative analysis of 3 case studies, mainly based in regional England, but also a German case study. And then some sort of synthesis of this mixed methods approach. So if we look at the issue of health in terms of obesity in England, you can see basically, obviously, you know, this is one of the increasing aspects that we're facing in terms of a health crisis, and the UK is one of the most, if not the most, obese countries in certainly Europe, okay, if not the world, and that's projected to increase. So we've got a huge problem of health in the country, which is fairly obvious locally. If I look around, you know, in my neighbourhood, I see that anecdotally on a daily basis, and that impacts on overall health of the population, which has been neglected effectively by lack of investment in infrastructure at the regional urban level. So the basically research question involved first one, the distribution of swimming facilities, which was a sort of statistical study. Is it significant for mortality there effectively? Right. The second one was I looked at 120 years of construction of swimming pool facilities to see if that was longitudinally in line with the growing population. Now, people may say, "Oh, what's swimming pools got to do with anything?" Swimming pools is just an example of regional infrastructure, which is important for health. Now, in different cultural contexts, we might be talking about different types of facilities, and I'm not mandating everyone should be building swimming pools. That's just an example. And basically, after the longitudinal study of the construction, to see if this was in line with the other parameters, growth of population, GDP, then I looked at the case studies to see what we could bring out from a qualitative angle. Sorry. One second, I seem to. Is my screen still visible there?
None. We can't see it. You need to reshare.
Yeah, sorry. All right.
Right. Got it.
Okay, so this just briefly summarizes the overview of the approach that I took. You can see the literature review is first of all put into a contextual historic context, then the structural literature review to tease out the most important variables, and the cross-sectional analysis, then the time series analysis as the quantitative or normothetic approach, and then the ideographic studies. Bromley, why? Because I grew up there and I saw the neglecting infrastructure. Cirencester, because I live here, see the neglecting infrastructure on a daily basis. Ludenscheid is in Germany, and I picked that out because my wife goes there regularly. So that's kind of the basis for that. If we go back to antiquity, the first thing that strikes you, obviously, is in ancient Rome, the bathing facilities. For example, in 33 BC, at that time, there were 170 registered private baths. But within 400 years of the Roman Empire, there were more, 850, according to classicist historian Lane Fox. And obviously, the most significant at the moment, in terms of architecture, in terms of ruins, if you like, are the baths of Caracalla, which are the most imposing. And here we have a picture of what the facilities were like, according to an artist, a well-known artist in Victorian artist. But basically, at that stage, it was mixed bathing. But earlier on, it was single sex. But obviously, these, as I'm saying, culturally may not be suitable in all circumstances. But just to give you an idea of what we're dealing with in terms of ancient Rome. Spatially, what strikes you when you study these cities in antiquity are driven by plunder, effectively. So I'm not really holding it out as a kind of example of a smart city in many ways, but architecturally, certainly from the public realm, you can see that quite a significant, very significant amount of space was devoted to the bathing facilities. And these were spaces where people could interact, social networking could occur. Obviously, people looked at hygiene was there. In fact, with the pandemic, perhaps there would be some issues there, but people could look after their health there and interact socially. And of course, there was a great mixing between the social divides there. Even the emperors used to go to the public baths on occasion. Right, and obviously, as well as the bathing facilities, you've got various types of amenities, notably, obviously, the Colosseum, where blood sports was the rage at that time. Obviously, that perhaps would not be considered smart, but you did have horse racing. But in any event, then you've got the temples, so there's a lot of public realm spaces in the urban context, just in terms of to contrast with the current situation in many cities, which is totally driven by commercial considerations. And here we have the baths of Caracalla, as they are now in the ruin state. And you can see the extent of them and also how they were assuming operated at the time. And if we look at another city of Constantinople, or Istanbul as it is now, that is, from a totally different cultural context in Islamic perspective, but they had very famous, and extensive hammams, and they were multifaceted urban amenities with socio-cultural implications in terms of networks, health, and religious dimensions. And this shows the extent of them. So in other words, what we're saying, the ordinary citizen in those cities in antiquity and subsequently in the Ottoman Empire enjoyed great recreational and social opportunities due to investment in this sort of infrastructure, which the current capitalist system and globalized system seems to have neglected, and which the pandemic has exposed, basically, the fragility of all of this and the lack of wisdom, effectively, of totally relying on these global forces to deliver outcomes. It's quite clear they have failed in many respects. And we now have to have a reset to look at social inclusion and other modes of interaction between public and private sector, as well as the operation of the private sector. We cannot allow, and this is my great bone of contention with the system at the moment, and I teach and lecture on accounting, the current systems of, holding these companies to account do not include some of the social and environmental considerations to the extent that they need to do. The financial statement, it's all driven by private gain and profits return on investment for investors. We need a revolution, effectively, in financial statements in terms of to hold these companies to account. How are they actually delivering for the society, for community? Are they paying their taxes? Notoriously, we have, Amazon, Microsoft, all these massive mega monopolists who are not paying representative taxes. You know, apparently, for example, Amazon is only paying 12%, whereas ordinary UK citizens are paying a lot more than that. Okay, so here in England, we see examples in Durham, a city, a university town up north. You can see the total neglect of Victorian infrastructure that's gone to pot. And anyway, so that having tasted that kind of context, let's look at the literature that was conducted using, you know, in a sort of structured way, basically looking at health, disinfection, this sort of thing, to try and identify variables that could have been significant. And then we went on to having generated the suitable variables. The first phase was cross-sectional analysis. I'm going to kind of race through that. That involves exploratory analysis, factor analysis, and regression. And then the second stage was the longitudinal analysis. Okay, so here are some of the variables that emerged from all of this, and that which I accessed basically. I won't bore you with the details of all of this, but you know, obviously some were related to the deaths, cross-sectional analysis of deaths in different locales, access to leisure facilities, obesity, deprivation indices, the environment, an index for the environment, and the number of pools. The objective of all this is to see if swimming pools was significant, and then the time series data looked at you know, the pools constructed over 120 years and output and GDP, as well as English population, to see if they were in line effectively. Okay, in terms of the cross-sectional analysis, principal components was exploratory to distilled out two basic groupings, if you like. First of all, the privileged locales, which is negatively correlated with deaths, as you'd expect. And the second is a sort of semi-rural locales, which don't have obviously access to green space, but they have a dearth of sports facilities. And again, it reinforces in simple terms the geographically and socially fragmented English landscape. I mean, if you've ever been to the UK, that's one of the things that strikes you, the contrast between, you know, London, you know, where the oligarchs live, those exclusive neighborhoods like Mayfair, but more generally speaking, throughout the whole country, you can have cities which are kind of deprived, and then the next city a few miles away is more for social elite. You know, elites, more privileged locales. In terms of trying to do a cross-sectional analysis to see if swimming pools was significant, you can see that the variables that emerged included obesity, access to leisure facilities, deprivation, and the environment, as well as the number of pools local. The LGA is a spatial administrative unit, if you like, and looking at that, and you can see it does seem to be some sort of indication that you know, the more pools you have in an area, which is a proxy presumably for infrastructure, the lower the death rate. Okay, but obviously the most significant variable there is deprivation, and that's well known, well structured in the literature. Obviously, basically, the lower the deprivation, the lower the deaths, as one would expect. And these are the statistics for that type of regression. You see the F statistic, overall significance of the regression is significant, and you have the adjusted R squared, which seems to indicate that the overall regression does explain 67% of the variability in the death rate, and the VIF seems to be with an acceptable range to control for multicollinearity. Okay, so with some comfort at that, you can look at the individual significance of these variables. They all seem to be reasonably significant, but the pool one, if you notice at the bottom, is definitely significant, and the chance of it arising by chance is nil virtually. And so, in summary, it does suggest that all the coefficients are significant at the 5%, and that pool density is significantly associated with mortality. Okay, basically. Now we went on to the time series data, looking at 120 years of construction to see if that was correlated, if we're building enough pools, essentially. And these are the variables, basically, the change in pool construction versus the lagged indicators of change in pool construction, GDP, change in GDP, change in lagged change in GDP, population, and lagged populations and change in population. And using the error correction model, this was the actual data of the construction in pools over time. the mean pool constructed, and you can see over time it peaked in about, it's obviously fluctuates, but peaked in about 2005, and since then has been a very steep decline, indicating the neglect of regional infrastructure that anecdotally one sees all around oneself, as power is concentrated in these global corporations in the globalization type of agenda. And you can see when you actually model, the model is, this shows the how the modeling kind of can mirror the actual reality. And you can see the modeling is in blue. You can see that beyond the current period, the model is telling you, well, we should be building more pools. It's got to go up, basically, to correct. So that's providing some statistical evidence that we're not building enough, and that we need, the computer's basically telling us we need to build more pools. And again, another model, another type of, the number of pools, again, suggesting that we need to increase the construction of these regional sports facilities. That is seen by anecdotally, as I illustrated previously with the Durham and other swimming pools. And this is another version of that type of modeling, again, suggesting that. So the conclusion is that the cross-sectional analysis refuted the idea that pool density has no influence on deaths. The time series modeling shows that that we need to increase, obviously subject the pool construction, subject to appropriate evaluation and planning. And now the next phase, having got the statistical backup to my argument, the next step is to go down the qualitative route and see if we can enrich that with some idiosyncratic swimming pool case studies. And I picked 3 case studies: Bromley, Cirencester. Bromley is a London suburb. Cirencester is about an hour 20 west of London. And it used to be, in the time of Roman conquest, it was one of the major cities, if not the major city, because it was the intersection of the Fosse Way, which goes up from Exeter to Lincoln and links the main river systems, the Severn and the Ouse river systems and the agricultural surplus from that, and the other road across the Welsh River Severn towards the mineral resources of Wales. So the Romans thought about things, and they knew it. Plus, as well, it was an iconic religious centre, and so they wanted to control the power of the Druids there by dominating it, basically. Anyway, let's look at these, and it involved, visits and recollections and online information. Here we have Bromley, is a suburb in London. That was the pool facilities that I grew up with as a kid. And we would go there every weekend. In the summer, all the children would go there. Now it's been taken over. It's become a global corporation that has taken over. Vodafone, or one of these mega Virgin media groups somehow. One of these global private equities has taken over. And what do they do with it? Shut down access, denied access to local kids who have nowhere to go now. Then they say, why is knife crime increasing in London? And then they built a luxury gated recreation centre for only rich elites, private clubs, facilities. Basically, you have to pay massive premium membership to get access. So you can see that the system has generated this, exacerbated the inequalities, and basically plundered state resources effectively, what that used to be for the community, to the private sector. We've seen this huge transfer of wealth, surreptitiously plundering the state public realm, public resources, and giving it to the private entity. Only now, with the the oligarchs, we're bringing them to book finally. But the whole English system been infected by this for decades. This toxic extractive methodology of operating. And if we look at Germany, you can see here Ludenscheid, the contrast between the German city. This is a small regional city. Excellent facilities there for its community compared to the neglect in UK. And this is just an example that, it puts the country to shame, frankly. So the conclusion, the idiographic case studies illustrate bathing facility complexity in diverse geographies. The exemplary German facility contrasted with a mismatch between the English health rhetoric from ministers and the liquidation of facilities effectively, and the expropriation by private vested interests. And even when I looked at the Cotswolds, another case study, I haven't got time to do that, but basically the same story, basically, the privatization, semi-privatization, extraction of public assets, really. Obviously, the contrast with ancient Rome seems quite marked. The case studies bring interpretive insights that seem to reinforce statistical concerns about English health phronesis. Phronesis is a Greek word meaning wisdom. I think Aristotle was one of the main guy who promulgated that idea that we need a bit more phronesis in life, effectively. So the conclusion of the study investigated the impacts of pools on health. It used mixed methods in 5 phases. The contextual and structured literature expounded Rome's classic achievements, notwithstanding the slave economy, obviously. Cross-sectional analysis found deprivation and obesity, but also swimming facilities statistically influence mortality. Time series statistical analysis, 120 years of English construction activity from 1900 found infrastructure increasingly erratic and inadequate for health needs. Finally, for policy, insight and learning, the study conducted idiosyncratic interpretive research involving 3 swimming pool case studies, and they illustrate the complexity and contrasts unsatisfactory English public asset management with seemingly more enlightened overseas provision. Obviously, the limitations, there's always limitations for research, but one thing that was a concern was that the data on mortality was aggregated data, so better results would come from individual level personal panel data analysis. Okay, and there's some other idiographic. You could extend the idiographic case studies. Basically, implications is that more local spending on sports, facilities, or other public realm facilities that promote health, and obviously more local consultation to identify culturally appropriate facilities. I'm not in this study mandating that everyone should start building swimming pools, no. But what I do say is we need more regional public realm infrastructure to promote health and interaction and resilience in the community. And then there's selected biography. Thank you for your attention. Thank you so much for your attention.
Thank you very much, Simon. Yeah, thank you very much, Simon.
Okay.
That's a very energetic presentation.
Thank you. Yes. Very ranting and raving. I do thank you for putting up with my rants and raves. You know.
Very passionate about swimming pool. Okay, Dr. Marit has saved the most interesting title for the day as the last for the last presentation. The title is "God is Nowhere: Challenging Secular Urban Imaginary." The presenters is a team of 7 presenters. The first is Christoph Nauratek from University of Sheffield, UK, and from Federal University of Minas Gerais, Brazil, Gabriela Alcantro Azevedo, Carolina Soares Lima, David Medeiros de Fritas, and Bernardo Miranda Patar. So over to you, Christoph. Screen is yours.
It's not me, it's Carolina and Bernardo. So
okay. I like the title, by the way.
Hello everyone, how are you? Can you listen to me?
Yes, we can hear you.
Yes, okay, thank you. So first of all, I would like to thank you for this opportunity. It's very nice to be here. And also would like to congratulate the other speakers and very nice presentations so far. I'm going to share with you guys my presentation, just a second. Can you see it?
Yes.
Yes, okay, thank you. Yeah.
Right, great.
So this is our research, God is Nowhere, Challenging Secular Urban Imaginary. The research group is composed of Gabriela Alcântara Azevedo, Daniel Medeiros de Freitas, Carolina Maria Soares, Christoph Nauratek, and myself, Bernardo Miranda. So I'm going to introduce to you our research. This research is meant to be an exchange between architecture, urbanism, and religious studies. Our research is rooted in the lived religion perspective, which is attentive to religious practices and experiences of transcendence in everyday life. So It encompasses religious discourse, embodied practices, and the materiality of religion. So one of the questions that we try to answer in this research is how believers perceive themselves in the world around them, the space. Mircea Eliade is one author that we use in the research, but we at the same time we think of him as to be a good introduction to the discussion between the relation of religion and space. So for religious man, space is not homogeneous. He experiences interruptions, breaks in it. Some parts of space are qualitatively different from others. For religious men, this spatial non-homogeneity finds expressions in the experience of an opposition between space that is sacred and the formless expanse surrounding it. So when the sacred manifests itself in any type of hierophany, there is also revelation of an absolute reality, opposed to the non-reality of the vast surrounding expanse. The manifestation of the sacred ontologically founds the world in the homogeneous and infinite expanse in which no point of reference is possible and hence no orientation can be established. The hierophany reveals an absolute fixed point, a center. So the relation between religion and space, it's actually pretty deeper than we first thought. Sacred space is not the stimulus for ritual. Ritual has a sacred making behavior, brings about sacred space. So ritual takes place and makes place in this sense. Spatial practices denote the way people generate, use, and perceive space. At the same time, religion in its physical presence, social orderings, and cultural forms is a consequence of spatial practice, though it is the attribution of meaning that gives such practice its character as religious. So we try to summarize in some extent the different ways that religion tend to see space. So pre-modern religions tend to see the world as an enchanted place, filled with magic and stuff like that. But modern religions, in the other hand, tend to see the world as a disenchanted place. It relates to the world more in a spatial and material way, in practices. So, and what about the postmodern religions? They also tend to see the world as a disenchanted place, but now faith is embedded in believer. There is still sacred places, but mainly faith is embedded in the believer, as we're going to see further in this presentation. So there could be at least three perspectives to discuss religious spaces. First, religious spatial infrastructure, which is spaces for practicing religions like temples, spaces difficult from a religious and moral point of view, such as nightclubs, brothels, temples, and other religions. Second, religious cultural visual infrastructure. So buildings and places visually related to a particular religion is also very important. Cultural, religious hegemony. So the third perspective, we broke it down in another three perspectives. So first we have the subjective infrastructure, in which sacred space, places loaded with spiritual meaning, constructed individually by a religious spiritual person out of profane elements. We also have spaces of hierophany, which is the places that the sacred manifests itself. And last, an infrastructure of religious memory, spaces related to religion and religion-related events. The importance of the place is relevant only to people who remember. Now I'm going to give you a brief context of the religious landscape in Brazil. So the majority of Brazilian population is Catholic, but between 1980 and 2010, Catholics declined from almost 89% of the population to 65, a drop of almost 25 percentage points. Evangelicals at the same time jumped from 6% to 22%, an increase of 15 points. Pentecostals specifically had a 44% growth, which is in fact a lower growth than the previous 2 decades. Those that claims to have no religion, without religion, increased almost 5-fold in size. The group of other religions, including spiritualists and Afro-Brazilian religions, doubled in size, going from 2.5 to 5%. So Belo Horizonte, which is the city where our research takes place, is the 3rd largest urban agglomeration in Brazil. It has a territorial area of approximately 300 square kilometers and an estimated population of 2.5 million people. According to the demographic census conducted in 2010, Belo Horizonte had an evangelical population of almost 600,000 people, of which 270,000 approximately were Pentecostals. Umbanda and Candomblé, which are religions of African matrix, are only about 4,000 people. So we can see in Belo Horizonte a kind of reproduction of the demographics, the religious demographics for the whole Brazil, of the whole of Brazil. So here is a map of Belo Horizonte and the metropolitan region surrounding it. 5 religious organizations were created every 2 days in the state of Minas Gerais, which is the state which is the state of Belo Horizonte, and between 2010 and 2017, totaling 6,500 organizations. So, as I said before, Catholics represent 60% of the population, and evangelicals specifically are 25% of the population. I'm going to talk briefly about the Neopentecostalism, which is the focus of the research, Neopentecostalism and Candomblé religions. So Pentecostalism arrived in Brazil in different waves. The first wave, identified by researcher Paul Freston, began in 1900 until the 1950s. The second wave of Pentecostalism begins in the 50s and goes through the 60s. And the third wave comprises the periods from the late 70s to the 80s, with the creation of the Universal Church of the Kingdom of God in 1977, and the International Church of the Grace of God. So this third wave of Pentecostalism is also known as Neo-Pentecostalism. The reason why is named Neo-Pentecostalism sorry, is because it presents a great contrast when compared to the denominations that precede it, such as its emphasis on the search for wealth devoid of asceticism, as well as the presence of elements that can be considered magic. So candomblé, candomblé is a Brazilian religion with its spiritual roots tied to the Yoruba ethnicity in 3 specific places in Africa: Nigeria, Congo, and Angola. Just a second, please. So in candomblé, there is more emphasis on oral tradition, as well as consulting the dynamic game of cowrie shells, or Ifa, Opele Ifa. In the candomblé, there is the deities that is called orixás. There in Brazil, there is 16 orixás that are cultured, but in Africa there is actually a lot more. It's pretty different. So as we can see, we have here on the left the cowrie shells game, and on the right the Opele Ifa game. This on the left it's the biggest cathedral in the state of Minas Gerais. It's from the Universal Church of the Kingdom of God. It's in Belo Horizonte. It's massive, as you can see. And on the right, we have another Pentecostal church, which is God is Love, and is way smaller, as you can see, but it's a nice contrast. So now I'm going to give the floor to my colleague, Carolina. Thank you very much.
Hello, everybody. I'm going to continue the presentation. Concerning our research, we aim to have an intersection between architecture, urbanism, and religious studies using the concept of space. And we have some premises, and one of them is this: the perception of space becomes mediated by religious narratives plus the individual's own subjective, thus influencing the way that they understand and act around space. Okay, that's why this research is important. And the researchers are architects, geographers, and sociologists. Go, please. And so the first things that we were okay, thank you. The first thing that we were trying to understand is that the public and private contrast was equivalent to the sacred and profane. And this was our starting point. And we also used to question ourselves that if the secular perception of sacred and profane are the same as religious people have, right? This perception, are they the same? And if there was any difference between sacred and profane for different people. So we already understood that Pentecostalism grants a certain autonomy to its followers, who, depending on the denomination they belong to, they have a greater freedom to interpret the Bible. So we can see that the sacred and the profane will differ. And in the case of the candomblé, there is no clear separation between the city and the nature. And this is a reason that why there are not many profane spaces in the city for the candomblé. So actually for the candomblé, there is no profane spaces at all, because they don't see the presence of, they see the presence of the orishas everywhere. You can go to the next one, please. And knowing that they perceive space in a different way, Neopentecostals and Candomblécists, we wanted to know if they produce different spaces as well. So we have the institutional space production that is different from the produced through experience in space. And we have the question, like, can religions be different methods of space production? So we're trying to comprehend how religion is actually a method of living and space production, and also how space perception is influenced by religion and by consequence in space production. So we already run some interviews to help us to comprehend this, and we have the same question to all of them concerning specifically the pandemic situation, because since the pandemic situation put us in lockdown, people stopped going to the temples. So we started questioning ourselves and also questioning the interviewers. Where is God if not at the temples? So the condomless people that we interviewed, I have here two extracts, one male and one female. The male guy, he said that to him there are not profane spaces at all, but there are sacred spaces. To him, sacred spaces are those where a group of people gather to sacralize it, or nature spaces like rivers, rocks, and so on. To him, a temple without the intention of people is not sacred. Due to that, every space can be sacralized. He also said that once he needed a sacred answer, and to find it, he went to the road and looked for water bodies to connect with Iemanjá, that is a Orisha that is connected with the water. And the female one, she said that the art in the city in Belo Horizonte, just like this picture over here, there are several symbols in the town that are related to the Orishas. And she also said that they noticed the presence of the Orishas in specific spaces or even people related to the usual practices of each space. So this leads us to a hypothesis that, can you please return to Candomblé one, please? Okay, this leads us to a hypothesis that even though the temple is a sacred space and it is important to religious practices, people got to find other ways to perceive the sacred in the city and in the space during the pandemic time, during the lockdown. Can you please go further? And then we also interviewed some people that are from Umbanda, that is a similar religion to Candomblé. They are also a Brazilian religion, and they are also African-based religion. So we found out that there is a fascination difference between evangelical Christians because they use sacred texts, and Umbandists and Candomblécists, they don't have sacred texts. So all the religious practices depends on the people, depends on the contact of people. And this female person from Umbanda, she said that the center that she attended was closed during the pandemic, and she respects that decision, but she misses the intensity of the ritual, which is something she cannot reproduce at home. So during the pandemic, she was meditating, studying, and reading, and also practicing spiritually by dancing. So what we can see is that they miss the temple, but they can find other ways to connect with their religion. However, the Neo-Pentecostals put it in a different way. Can you please go further? So even if the temples were by law closed, some of the Neo-Pentecostals were still attending to the church, but not all of them. And they increased the dependence of the radio and also online interactions and social media. So we started to see that they are using technology and virtual interactions to construct the sense of sacred inside their own houses. But they also said that they are going to the church, they were going to the temples, and the church leaders connect the COVID situation with other contemporary problems. And they all together perceive these as symptoms of the secular world. We also understand that the believers that we interview organize themselves in WhatsApp groups, and the typical WhatsApp invitations for for gatherings end up with the phrase, the altar is not on quarantine. So even if they didn't need to be they needed to be in lockdown, they were not following these orders because for them the altar was not in quarantine. And this is something really interesting because Neo-Pentecostals, they have a text, a sacred text, the Bible, and they can study the Bible without the temple. And the African religions, they cannot study their religion without the temple because they need the presence of on. And we understood that even if they need or don't need the temple, the ones that don't need the temple because they have a text, they were attending the temples even if it was not allowed. Can you go, please? And talking about faith, every person we interviewed said that faith was important for them in time of crisis, just like the pandemic. And to keep faith and stay connected to God, even beyond church buildings, they use online group chat and media content related to religion. But some of them say that they don't need any particular place to feel connected to the God. All they need is to pray. And those that said this are the ones from African religions. And this seems to be to make the experience of the Neo-Pentecostals and the Candomblists a little bit different. While Afro-religions seem to value rituals and social aspects of practicing religion, Pentecostals tend to content with a more one-way and distant connection. However, they were not staying in lockdown as much as the other groups. Can you please go? So this leads us to a question and some of answers we can take out of the interviews. This, where can one find God in a post-pandemic city? And we understand that God is not more only on the temples. God is in people, God is in nature, God is in movement, God is an intention, God is on TV, on internet, and God is basically nowhere because it needs the intention of people to make the place sacred. So I would like to thank you all for this opportunity to share with you our ongoing research. And Bernardo, can you pause, please? And have a nice day, you all.
Thank you, Carolina.
Thank you.
Oh, would you like to say something, Christoph?
No. I would
Yeah,
like to thank my colleagues too for presentation and you for listening. So
okay.
that's it.
Hopefully you can join us during the discussion later. Okay, so we have completed all the 6 presentations for the day. I think all very interesting, covered quite a wide range, even though the topic or the theme set is singular. All very interesting. I wish we have more time on individual, but hopefully the presentations actually offer a platform for networking and further collaboration between universities across the globe. So moving on to the next session before we end our symposium today, we have about 40 minutes discussion or Q&A. And for that, I would like to invite Dr. Marit first to address questions or clarification you may want to give to any of the speaker. Dr. Marit?
Okay, thanks a lot. And it were really interesting presentations. Of course, starting with Architect Moos about what should happen in terms of guidelines for cities and buildings in Malaysia, and then very interesting presentation on Kenya. And actually, Africa has been sort of like this. This will be my first question to the presenters, that Africa is sort of like not really exposed in this pandemic. You don't talk too much about it. I'll come to that question. And then we had the next presentation about smart cities and very interesting research you're doing in Turin and Athens. Then, of course, Simon with his very interesting observation about swimming pools and baths and the fact that so many public places get taken over by private corporations, which is, making this city much less inclusive than it used to be when he was a boy. I think that's noticeable everywhere, but I think that probably UK is a place where you notice it most in all of Western Europe. And then, of course, the last presentation, really interesting about religion and COVID, about the fact that traditional religions are on the rise in Brazil. Okay, I'll come to my first question, and that will be addressed to Nidhi, Asma, and Sina regarding their research in Kenya. And one general question is, what was the reason that Africa is not really exposed in this pandemic, apart a little bit South Africa during Omicron? And based on statistics, South Africa dealt with Omicron really well, much better than European countries. No panic, no nothing, and the cases came down. Is it because, well, Africa was spared in some way, or is it because there's no information about it? What is the reason that Africa doesn't hit the headlines like other parts of the world?
Thank you so much. Thank you so much for that question. I think I'll go first. In terms of Africa, I think it's grouping it as a region is difficult to think about the data on COVID with that, because I mean it's a region with very many countries, and each country has different ways of monitoring, and there is a data situation where the testing facilities, for example, in Kenya were not as vast and broad as it was in the West, and so the data of that was not as conclusive as it could have been in the West. Also, to think about, Africa has also grappled with sort of epidemics, if you think about Ebola amongst others. So there is a sort of preparation, or there are sort of strategies around thinking about diseases. So there might have been a level of preparation in that sense, but saying that the whole region was not necessarily affected may not be true, because there are the data on deaths and infection rates are not necessarily properly conclusive. They are conclusive in urban areas, and that's where you can find most of the data. But yeah, I think that's mostly what happens in the region.
Okay, so what you're saying is that the data, the real number of deaths and cases could be much. I think in terms of the number of cases, everywhere we have, the official number is much lower than the recorded number. And of course, the number of cases depends very much on how many tests they have done. So where there's a low number of tests, that's why there's a low number of cases. That's why I don't really look at cases anymore, because that's very much determined upon tests. Deaths, yes. Deaths in other parts of the world, like here in Malaysia or Indonesia, everywhere, a death has to be reported. You cannot sort of like let somebody die and that's it. That's why looking at deaths is you get a good picture of how severe the virus is. Okay, thanks a lot, Nidhi. And my next question is to Anna and Hertie and Mara and Orlando. Now, Anna, you've talked about Athens and the very strict rules that they applied at the beginning of the pandemic, which kind of worked quite well. But then since summer 2020, Greece has taken an 180-degree turnover. And I remember my friends went for a holiday there September 2020. They were showing me videos and images looked pretty normal. And since then, I think Greece has not sort of like diverted back to its lockdowns anymore. Is it, in some ways, it has followed the advice of scientists that, you lock down in the beginning very, very rigidly, and then you loosen up. And since the vaccination has been pretty open, because again, a lot of my Polish friends actually went to Greece for a holiday last year. So would you say that what was the reason of this 180-degree turnover in summer of 2020?
I think, thank you for this question. I think that there are two reasons. The second source of revenue for Greece is tourism. So you couldn't possibly let the economy suffer again. Second, there was demand. And I think on a practical level, apart from the scientists' advice that lockdown is essentially not that efficient, I think once we have loosened up, it was very difficult to introduce the grip again. Also, the society wouldn't stand it. And I think the most important thing is that the vaccination process was very successful, and people were actually wearing masks, which is not the case of Poland. I travel frequently, so in Poland you would see people who were not wearing masks, whereas in Greece everyone did. Schools were closed, so children were having remote education. Universities were closed, which was not the case in Poland. So on a comparative basis, several measures were in place. It's just the lockdown was not as severe as it was.
Okay.
Thank you.
Yeah. Yes, because with our research here, I think once we can, they open the borders here, we would like to compare a few cities like Kuala Lumpur, Bangkok, which have been, well, Bangkok now is open, but it has been closed off for it, with cities in Europe. And we were thinking of Athens and Istanbul. The only problem with Athens is that Athens has quite a large number of mortalities, twice as much as Kuala Lumpur. Istanbul, no. Turkey is on par with Malaysia in terms of mortalities, and has been open all the time, and has done reasonably a similar amount of tests. So Turkey is a good sort of like example of that. Well, they opened the tourism, and you can do it. But it will be interesting to see what was the impact of the lockdowns on the tourist industry. For instance, do you have a lot of hotels still permanently closed in Athens or Greece, or you don't?
No. It's just that the hotels were also forced to introduce extra measures to accommodate the hygiene related to COVID. So this is one point. I think this important issue in relation to the death numbers is, and frequently rarely talk about it. I mean, you cannot compare it to the size of the population at large, but you should also look at the demographics. So the Greek society is relatively old, so also the number of vulnerable cases of COVID is higher. So I think this kind of statistics and comparisons would be complex than just comparing the numbers.
Yeah, I know, and this is the same with, I was talking a few weeks ago to another colleague about the UK, and we were talking about, that in the UK, if you look at the number of deaths during the COVID, is double that of Malaysia, but per 1 million population, of course. But then if you look at mortalities in the UK any year, 2016, 2015, 2014, it's double and a half in comparison with Malaysia. And the reason for that is UK has 21% of its population over 65 and Malaysia 6. Well, obviously, you do expect it to be much higher. So I think it was sort of like kind of reflected in COVID. Okay, thanks a lot, Anna. And Mara, your choice of Turin, was that, or Torino, as you say it nicely in Italian, was that because of that it was the first cradle of COVID, where it all actually started in Europe, and maybe they're the first ones prepared to find smart devices to challenge it?
Yes, it was a best practice, we can say, even before the advent of pandemic, but Piedmont and Lombardy were the two areas, the two most affected areas by COVID-19 at the beginning of the spread of COVID-19 in March 2020. And we can say that differently from Milan, Turin is a smallest city and has subsequently a stronger healthcare system. So I think that a key role in the effectiveness of the response to COVID-19 in Turin was played by the period before the pandemic. So by the skills and the infrastructure they developed before the pandemic, and also it depending on the effectiveness of health system in that region.
Okay, thanks a lot. Thanks a lot for that and good research. Congratulations. Okay, my last one, because I just a very quick question to the last group, to Carolina and Bernardo. What is the because I'm not surprised that the number of Catholics is diminishing in Brazil, because it's also diminishing in Europe. But in Europe, after they renounce that they're not Catholics anymore, they don't go to any other religion. They just say they're atheists, or not more atheists, but deists. Like they believe in God, but well, they do what they like. They don't go to church, pray, or any other. They sort of like they become secular. Oh, good way to say secular. I'm quite surprised. Why is the interest in evangelism? Because evangelism, to me, well, it's not is it that progressive in comparison with Catholicism?
Come again, please.
I mean, why is there a sudden interest in evangelism? So my question is, okay, like in Europe, you say, I'm not a Catholic anymore, I am secular. Okay, but you don't go to any other religion. In Brazil, it seems that they go and turn to other religions like evangelism. Why is that?
Yeah, so you want to answer, Gabby?
Yes.
Okay, go for it.
We see it as a matter of a social economical problem, to be honest. In our researches in the past, we have seen those evangelical churches help a lot and make a very strong support in other aspects of life. They are not necessarily religious ones. Like they help you, they build like a strong connection between the followers, and they help each other finding jobs, and even services like preschools, and a lot of help with family issues, drug issues, marital problems. So they evangelicals, not all, of course, because they're very different from each other, the churches, but they share this this support system, which is very, very appealing for a country like Brazil, where more than half of us are in not a very good socioeconomic situation. So it would be inclined to that reason.
Okay.
If I may add, just quickly, evangelicals also have a pretty aggressive political engagement in Brazil. So that's why that's one of the reasons that we are studying them. Like they were very important on Jair Bolsonaro's election. So there is evangelicals in a lot of senses are very important to the political and social moment that Brazil is going through right now. Yeah. So, any more questions?
No, I think I'll pass. Maybe, sorry, Kamal, would you like to add anything or ask any questions from our sort of like team side?
May I ask a question?
Yes, sure. Go ahead.
Okay, coming back to that question about Catholic evangelists and also another new religion, right? I just a question to the researchers. Were the Catholics born with religion of Catholics, or were they, how shall I say, could become Catholics? Probably that can be the reason why there are such high fallouts of 25% after the pandemic. Were they born as Catholics or otherwise? Just a post question. Thank you.
Yes, traditionally, Catholics were a family tradition. Like you were born into a Catholic family, most likely you would become a Catholic. But that's changing. 20 years from 20 years ago from now to now, I think it's becoming more of an individual choice. People are choosing to become Catholics, choosing to become evangelicals. Each religion offers different things. So people actually it takes a while for them to commit to a specific religion actually. So they transit between different religions. There isn't even cases where evangelicals go in terreiros to consult with candomblés. and yeah, it's a very diverse landscape. You want to add something, Gabi?
Yeah, I was gonna say that the Catholicism was brought to Brazil through Portugal in the times of colonization. So it became the official religion of the country from the 1500s to up until 1912. And then it was losing strength like it has been losing in many other countries. And the evangelical found this great gap to work. That's almost like what's happening here.
So when the Catholic Church become no one going over there, do you still keep it as that church, or is there any new, how shall I say, this adaptive reuse to a different kind of religion or something like that? Just a question, because I think in urbans, right, nothing should be left how shall I say, unused, and I think this is where pandemic has taught us that resources in terms of buildings, land, quite important, especially to the city people or even the people itself. And because my paper was actually posing that the people now is taking over and making sure that the facilities are actually to the use of the people rather than we build facilities just because there's a requirement. So how do you go about that? Thank you, Mustafa here.
It's okay, thank you.
Dr. Kamal, do you have any question?
No, sorry, I couldn't get my camera on, so I was slots now. I guess I just posed a question without my video on. It's interesting, Minas Gerais. I remember this from that movie, Central Station, the Brazilian movie that hangers into my mind. Beautiful one. The question about evangelists, the way I look at it from outside is that it's very proactive. Supposed to Catholic, they become more conservative. But still, the growth you can see the different growth there. But one new phenomenon I see very interesting was I know after the Ukraine incident that the growth of Orthodox Christianity is very high now. 3 churches are built in Russia every day because people are going back to religion after communism. That's a very interesting phenomenon. So wondering how we can compare this also with the COVID part of the world. But that's just interesting thing. Thank you.
Yeah. Do you have a question to ask, Dr. Kama? Yeah, perhaps not. Maybe then Dr. Zaki has a question to ask. I would prefer that Zaki, you address your question personally since you're here.
Okay, maybe this is to any of the presenters. I've written there that the pandemic has pushed us to rethink the way we operate our civilizations. And I believe some good strategies and measures has been put forth, which really help our green and sustainable agenda. But would you think that with the subsidies of virus in the future, when things cool down, that some of these benefits will be reversed? Anybody, whether it shows that whether the measures, the new measures that we introduce is just because of the pandemic and not.
Can I offer to
Yeah, yeah.
Okay. Thank you, Doctor, for that question. I think this is quite relevant. Remember in my presentation, I was talking about a new reality rather than just a new normal. So the reality is we need to understand that nature is very important first, and it has not to be looked at just a simple that you need to color green or even make buildings green. We have to live together with green and also nature. So I think it will not reverse back to what we were before. I think with this people power and the importance of having nature and also ecology and also environment, that will be extended much further. And I think with these panels here, I think they are going to push forward the agenda of this into another realm. And I actually think it is actually going to be very crucial because it's going to go much better than this. It will not reverse to that, I call it status quo before. So I think that's my simple short question answer, but certainly much more detailed movement. We'll be looking at resources like water quality. If you can put your feet in the river of Sungai Klang and Sungai Gombak, I think that will be the first time that we can feel nature in our city.
Yeah.
And I think that is what we're going to do there. Okay, thank you.
Thank you very much.
Maybe I can also add, I think it back to the question of Professor Fakhri. I think it also depends how we learn from this pandemic. Like, for instance, if you look at the statistics, only like 50% of Dutch people, after using the toilet, were washing their hands, right? So this means that like the disease may basically disseminate faster. But like okay, some people may say that the pandemic is over, but if we could slightly or significantly change our pattern or the behavioral pattern, probably the future can also be a more healthy future. So I think one may argue that we are living in the post-pandemic, let's say, situation and condition, but the way we learn from the past, and I think this is also the importance of the job that we do, the way we document our research and rigorously and aggressively, I would say, share the result of this research to the next generation would be really important. So, and learning from these differences around the world is something that we can take from this pandemic.
Thank you. Thank you, Sina.
I should add, I think one sort of like small remark, I think that the pandemic has proven one thing, that the neoliberal political establishment, male-dominated political establishment, let's face it, in most of the countries, has failed miserably in the face of that pandemic. Because this pandemic, I'm not saying it is a deadly pandemic, it is a serious pandemic, but in comparison with other pandemics that the world has encountered in the past 2,000 years, it is really nothing in comparison with cholera, plague, Ebola or even Spanish flu. And the world cannot even tackle with that because the world has been interested only in economic growth, progress, fast track development.
Exactly.
I think Simon has pointed it out really well in the UK. And in the UK, it doesn't matter which party is in power, whether it's the Tories or Labour. Would the Labour Party change anything? In the next few years if they come to power? Very little. It will be still the sort of the drive to make profit and to lower taxes, especially for foreign developers and all of that. So I think this world has failed, and we really need to develop a new world which is much more inclusive and which is much more sort of like community caring, but a world which does not impose, if it comes to the crunch, long-term draconian regulations making life for people miserable, because this is what in a lot of countries COVID regulations did.
Yeah.
They did that in a lot of countries. So this is something that we have to balance with. And I really hope that this pandemic will create a definitely better world, which get translated into architecture and urbanism and a better city, a more inclusive, people's-oriented city. Thank you.
Yeah, I can agree with you more.
Yeah, sorry
Love your
to
optimism.
interrupt.
Yeah.
Yeah, just
Yes, Asma.
can I add a point, like following the Marek's discussion, just a short point. I think that we have a kind of short memory to learn from the history, and like using the historical facts instrumentally is what's happening also before. So what I try to just add here as a note is like we have to somehow stop like cherry picking the historical facts. The thing that some of the kind of authorities are doing at the time, even at the contemporary time. So I really hope that we had really lessons that we can learn from this pandemic. Thank you very much.
Thank you.
Yeah, I also like to resonate what Dr. Mari is saying, and also from the takeaways that I have from the speakers' presentations today. It seems that what pandemic has done is actually push the societal resilience, the word some of the speakers used, where the society now take self-responsibilities or shared responsibilities in monitoring and managing the pandemic, which can be, continued with other situations as well. So the key thing here that enable that is actually communication, meaning that technology is the key factor. So then the question would then be, would this accessibility to technology would create a gap? Because across the globe, there could be, accessibility to technology is not the same, right? So what are your thoughts, especially in Kenya and in Brazil and all that? How do you see this in respective society? Would this technology create a gap, or should there be a serious effort in making technology as part of basic necessity, as basic as water and electricity? Yeah. Anybody can answer that.
I think the universal, just like income, right? They're talking about universal income. I think the universality of technology as a human right thing has to be given utmost importance. No, we cannot afford to see people from outside of the developed nation having easy access to internet for learning. When you see other countries are actually having to go up on the tree to actually get your access of internet. And I think that is very, very crucial and also very important that whoever is the technology provider, it has to be provided at a cost which is actually universally available to everybody. Then we call that it is equitable, and we talk about leaving no one behind, and this agenda SDG 2030. So I think until we can learn to do that, I think the pandemic will keep on having its own multiplier of other how should I say derivatives. So, nature will say, you are not learning, so I'll give you another kind of derivative. You are not still learning, I give you another kind of derivative. So I think we need to actually take this, point that we have to make sure that the accessibility to technology, accessibility to food, accessibility to even your the supply chain is very, very crucial, because now we know that the supply chain is not equitable. It is actually controlled by certain people or certain groups, and it has to be made open and it has to be accessible. And I think that is probably the one case that every one of us here, and including myself, to make certain that we, the knowledge persons, to actually promulgate all the sort of things. Mustafa speaking. Thank you.
Yeah, if I could say something. So I think the issue of technology and access is key, especially in thinking about how marginalized communities are going to move forward into the future. But I think it cannot be superficial in terms of just providing internet access, etc. I think it has to be core to how the people live. So, for example, here there's a proliferation of mobile networks because the financial services are used across the country and it's more accessible to people even in lower income communities as opposed to banks. So I think if technology, if there is an incentive to have technology as a form of, bridging structural inequalities, the incentive has to be that it's linked to how people live. So also augmenting and thinking about how because communities are technologically aware, like they know, they have knowledge within the community. So there's the indigenous knowledge, and thinking about that also in terms of bridging that gap, that indigenous knowledge and technological tools, and creating a bridge that is connected is also important, without it just being a superficial moving Western technologies into particular contexts, when particular contexts already have knowledge and have technical skills and technical know-how. And so bridging that would be a good way of thinking about resilience for their future.
Yeah.
Maybe one more thing that I can is about like a centralized versus decentralized model. So like if you look at a recent event in Europe, we see that like centralized models of powers are failing. And this really huge centers cannot communicate with each other. So I think the way we can empower a decentralized model and educate ourselves and next generations for a decentralized model in many aspects, like ranging from economy. So if the cryptocurrency is the future, but to make the whole economy more decentralized, we need a lot of efforts to educate ourselves and sort of observe and digest this decentralized model. And this goes to also fabrication, technology. But obviously the centralized model is somehow failing.
So you're saying that decentralizing model is the way forward rather than...
I think the centralizing model is the way forward, but I think maybe we are not ready in all fronts for that model. That's something that we have to accept and embrace. So the way we equip ourselves for decentralized model in the mid to long future, I think it's really important.
Yeah, I'd echo that. I think that's really important in terms of even from the financial perspective, as I was discussing the financial statements, which are not really giving adequate information. So as you say, preparing for that next revolution in terms of how information and citizens access that and make decisions is something that obviously is important. But the modality, I think, there's no simplistic solutions. I think it's quite a complex interaction of how we get people prepared, because I could devolve power to local citizens. They also need to be, and I was discussing this with Marek, also quite informed and educated. If we talk about local planning, just putting participatory planning, and I've been involved in local planning issues, I mean, people have a very limited outlook, a lot of people. And unless they're equipped with the education and the technologies, as we say, even just disseminating internet technology to everyone without the cultural and educational support mechanisms, unless the citizenry is kind of been educated to a certain standard, they're going to be victims of the internet as well, not just as a enlightened by it. So also this is some of the issues with the devolution. How do we get the citizenship to be able to handle that power, as well as the mechanisms to provide information, financial and other, about actually how these private sector entities are actually performing and impacting locally.
Yes, totally agree to that. Even in Malaysia, the common platform that government has created is actually very much a one-way system, where it's a tool for government to disseminate information and for the citizen or the community update status, and that's it. I'm hoping that that tool would be expanded to other means as well, in order to empower community to make decisions in respective context. That's my position. So it's 7:11 in Malaysia now. We are at the end of the time. So I don't know, Dr. Marik, do you want to proceed with further question, or shall we?
If anybody's got our last remaining question, maybe yes, and then we proceed with the concluding remarks by Dr. Zaki, I think. Yeah.
Anybody has any question?
There are some comments in the chat. If you don't mind reading them from Sina Asma. I mean, for the benefit, because in FB Live, the people won't be able to read the comments. So it'd be great if you can read those comments.
Okay, there's a note here to add another observation in a European context. We can refer to the Netherlands, as Marit also refers to. It seems the social and cultural behaviors and responses are very much different, even within the EU. For instance, a personal observation is that in the Netherlands, almost everyone was desperately waiting for their government to tell them not to wear masks. And now, if you wear mask, you may look like an outsider. While in some other countries, people are wearing a mask and they don't wait for the government to guide them and give them personal comfort. So this is also quite similar to Malaysia, whereby, with the latest variant, we see that even though there's no lockdown or control in movement, but we see that the road is half empty. The malls and all that is also half empty. So it's good to see that the society is now beginning to take self-responsibility. But of course, I do agree what's stated here, that it depends on the culture context. But that's a way forward. Hopefully, society don't have to rely on external factor to tell them what to do or what not to do. Yeah.
Can I share a poem about COVID? I wrote this on the eve of the lockdown in 2020 to our foreign friends and also to Malaysian friends as well, which is talking about what we should do and what we can do. Is it possible?
Okay, can.
Okay, this is a poem that I put forward here. The title is In My Opinion. So people think that the year 2020 is the year of perfection, but it's now a different route. The year 2020 is humanity reset button, to think for a better system to govern our lives, to work and collaborate for a better living, to rethink the way we need to work, to throw away unsustainable methodologies, to accept new collaborators and new game changers big time, to include the younger generation in our decision making in totality and not a mere rhetorical, to use the thinking way of out of the box, which is business unusual, to accept the thinking system of our subordinates more as a realistic one, to put aside wholly top-down thinking, but to respect the bottoms-up thinking rationally and pragmatically, to listen to the ecosystems more than the economic systems, to allow specialists to rule, to put aside generalists for the fear of a recurrence, to live simplistically, to love life as priceless, to transcend urban protocol systems as a living documents of life, to listen to your aspirations more than your fears, and lastly, to be a human is most important. Mustafa, that's speaking. Thank you.
Thanks, Mus. Over to you, Dr. Wan.
Yeah, thank you. That's quite a nice poem. I've been following
Architect Mus Facebook, and that poem is actually quite true. It reflects on a lot of us that is facing COVID right now. Okay, since we are towards the end of the session, I would like to, if there are no more questions or comments, I would like to first and foremost say thank you on behalf of the of our university, the organization here, to all the panelists and also to all the attendees today. So with that, I would like to invite Dr. Zaki to give his final remarks for the closing session.
Thank you, Dr. Wan. It has been a long day. It's 7 p.m. In the evening here in Malaysia. So let me cut this short. Thank you all for here. Thank you for all who are here today. Thank you, Dr. Maret, for arranging such a colorful session, bringing in together presenters from all over the world. The department would like to extend a big appreciation for all presenters for sharing such a wide perspectives and varied approaches in handling pandemic issues. Well done too for Architect Sophie and Dr. Wan Srihani for keeping the Putra Design Lecture Series alive. We hope to have you all in our future seminars. Please follow us on our FB page, Sinibina UPM Architecture. There you can also access our past sessions. I believe this seminar and the rest in the series will be of tremendous value in understanding the global crisis we are in. With that, I end this session. Thank you and hope to see you again.
Okay, thank you very much, everyone. Hope to see you guys again. Dr. Maret, we have to do this again.
Okay, thanks a lot, guys. Thank you very much, and we'll do it. Definitely, we'll do it again. Hope we can meet face to face, all of us, you know, in the nearest future. Yeah.
Okay, shall
Thank
we
you.
have a group photo?
Okay.
Have a group photo?
Can.
All right, great. Everybody, okay. Dr. Anna Vizvizi, is your camera on already? Can't see her. Oh, she has left. Okay, Datuk Kamal. Datuk Kamal?
She has no access to camera now.
Right, okay,
Yeah.
so that's only us. Right. Right, smile everyone. I'll send this to our chat group. Okay, smile. Okay, that's about it so far from me. Anybody else? Okay, that's it. I got everybody inside the screen.
Yeah.
Thank you, everyone.
Okay. Have a good day. To
Have a
those
good
on the
day,
other
yeah.
side of the globe.
Everybody.
Thank
Yeah,
you
yeah.
and have a nice
Okay.
weekend to all.
Bye-bye.
Bye. See you.
Bye.
Thanks.
Thanks, Dino.
Thanks, Dino. Yeah.
Thank
Good
you very
work.
much, Dino.
Okay.
Yeah, thanks.
Okay, thanks.